survey and gender identity, an estimate of 0.5% of people in New York State identify as transgender or gender nonconforming. In 2023, the National Youth Risk Behavior Survey assessed transgender identity in high school students in the United States and reported an estimate of 3.3% high school students identify as transgender. In New York City, gender-affirming care is provided, among others, by New York City Health and Hospitals. Health and hospitals offer services which include hormone therapy, puberty blockers, and gender-affirming surgeries. Other gender-affirming care procedures include voice therapy, hair removal, breast augmentation, chest reconstruction, facial plastic surgery, and genital reconstruction. Additional Health and Hospital provides training to all staff members on the special health, psychological, and social issues of TG and CNB individuals. However, some groups face more challenges when seeking services related to gender transition in New York City, and overall the challenges of TG and CNB individuals face in assessing and utilizing care can contribute to disparities in healthcare outcomes. More often than not, TG and CNB individuals suffer from prejudice and discrimination in access and use of healthcare services. Because of this discrimination in many health settings, these negative experiences make them less likely to seek health care services. This is concerning because studies reveal that members of this community are more susceptible to health problems such as abuse of alcohol, tobacco, illicit drugs, obesity, unprotected sex, mental disorders, sexually transmitted diseases as HIV, AIDS, bullying, and cervical and breast cancer. The relationship between consumers and health services is essential to strengthening the quality of care. So in sum, experiences of discrimination and prejudice against the TG and CNB community that can directly contribute to a poorer health status. Recently, out of 70 executive orders issued by the federal administration, at least 6 have explicitly related to sex and gender identity. One example is Executive Order 14187, designed to withhold federal funding for organizations that provide gender-affirming care for 19-year-olds and younger. In New York City, 2 families reported that NYU Langone canceled appointments for their teenagers to receive puberty blockers. In response, the New York State Attorney General Letitia James issued a warning to healthcare providers of ordering them to defy President Trump's order, saying electing to refuse health care to a class of individuals based on their protected status is considered discrimination. The Commission on Gender Equity, created by Local Law 45 of 2020, is a component of the Mayor's Office of Equity and Racial Justice. CGE operating principles stresses recognition of the diversity of gender and gender identity expression. The importance of operating with an intersectional lens. The populations of focus include girls, women, intersex, transgender, and gender nonconforming, and gender non-binary people, regardless of age, disability, ethnicity, race, faith, gender expression, immigrant status, sexual orientation, and socioeconomic status. Additionally, CGE partners with other city agencies to recommend and advocate for policy changes that advance gender equity in New York City while supporting research and analysis of relevant issues to better understand both the challenges and opportunities for gender equity in New York City. At today's hearing, the committee will seek to understand how CGE will partner with other agencies to advance gender equity, support research that will reflect gender identity beyond the binary male-female, and support community organizations in light of the executive orders and quickly changing legal landscape of gender discrimination protection. This hearing will consider the current landscape of healthcare issues for TGNC&BI people in New York City to gain a deeper understanding of how the council and the city can address such barriers and support the TGNC&BI community. The committee will also seek feedback on the legislation being heard today. Today, we look forward to hearing from the administration and members of the public and other interested stakeholders, including those with lived experience who have taken the time to come here today to join us, and we do thank you. I would like to thank my own staff as well as committee council staff members who worked so hard on preparing this hearing. Finally, I now will pass it over to my colleague, Councilmember Hanif, to share her brief remarks. After Councilmember Hanif, we'll have Councilmember Schulman. Thank you.
Good afternoon. I'm Councilmember Shahana Hanif. Thank you to Chair Lewis for holding this critical hearing and including Intro 1201, the Affirm Act, on today's agenda. I'd also like to thank Chair Lewis, Brooklyn Borough President Reynoso, and Council Members Bottcher, Rivera, Osei, Ressler, Hudson, Nurse, and De La Rosa for introducing this bill alongside me. In the 1990s and 2000s, the Council responded to violent protests at reproductive health clinics by passing and strengthening the Clinic Access Law, which established protections for reproductive health patients and the providers who serve them. While there are still issues with enforcement, this law has set important prohibitions on unsafe activities that threaten people entering reproductive health clinics. It is no secret that anti-trans protests are growing across the country as bigots feel increasingly emboldened by President Trump's trans erasure agenda. In this volatile political environment, it is important to use every tool we have to ensure trans patients can access care. That's why I've introduced the Affirm Act to have facilities that provide gender-affirming care covered by the same protections that apply to reproductive health facilities. If passed, the Affirm Act would make it illegal to physically block a person from entering a facility providing gender-affirming care, follow or harass a person within 15 feet of the entrance of a facility providing gender-affirming care, damage a facility providing gender-affirming care, and interfere with the operation of a facility providing gender-affirming care. This bill would also update previous legislation that I passed, Local Law 76 of 2022, to clarify that if a person wrongfully has their ability to access gender-affirming care infringed upon, either physically or by a lawsuit, they have a private right of action under New York City law. I look forward to hearing testimony from the administration and community members with us today. I recognize that this is a complex issue, and I'm eager to hear from experts who will share how the text can be amended to better meet our legislative intent. Trans healthcare is essential. The recent actions of the Trump administration and the cowardly compliance of certain providers are absolutely shameful. I'm proud to be fighting with my colleagues in this committee and in the LGBTQ caucus to ensure New York City is a safe place for our trans siblings to access critical medical services. I'd also like to extend gratitude to the local trans-led advocacy groups that are doing so much to support trans New Yorkers. As we enter the thick of fiscal year 2026 budget cycle, I urge the council to reflect their importance in our funding. Thank you.
Thank you, Councilmember Hanif. Now, I want to recognize, we've been joined by Councilmember Hudson, and now we'll hear from Councilmember Schulman.
Thank you. I am Councilmember Lynn Schulman, Chair of the New York City Council's Committee on Health and a member of the LGBTQ+ caucus. Thank you all for being here today for this important oversight hearing on ensuring access to supports for transgender, gender non-conforming, and non-binary people in New York City. I want to thank Chair Farrah Lewis and the Committee on Women and Gender Equity for convening this discussion and for their ongoing commitment to equality and inclusion. New York City has always been a place where people of all backgrounds can come together to build better lives. Our diversity is our strength, and it is our responsibility to ensure that every New Yorker, regardless of gender identity, has access to the support, resources, and opportunities they need to thrive. Over the years, the city has taken important steps to expand protections and services for TG and CNB individuals, from increasing access to gender-affirming health care to strengthening anti-discrimination laws. But we know there is still more work to do. Many individuals in this community continue to face barriers in accessing health care, securing stable housing, and finding safe and affirming workplaces. These challenges affect not just individuals, but families, neighborhoods, and the entire fabric of our city. Today's hearing is an opportunity to listen, learn, and collaborate on solutions. We will hear from advocates, service providers, and members of the TGN-CNB community about what is working, where gaps remain, and how we can improve city services to better meet people's needs. Our goal is to ensure that every person, no matter their gender identity, feels safe, supported, and empowered to reach their full potential. I also just want to take a moment to address an issue that has become even more urgent in recent months: the growing efforts in other states to limit access to gender-affirming care and reproductive health care. That is why I am proud to sponsor a resolution calling on the New York State Legislature to introduce and pass, and for the governor to sign, legislation to prohibit out-of-state access to New York's prescription monitoring program data for certain medications, including abortion medications, hormone therapy, and puberty blockers. This legislation is essential to protect the privacy of our transgender, non-binary, and gender non-conforming residents and ensure they can receive the care they need without fear of surveillance or criminalization. By working together across government, nonprofit organizations, and the private sector, we can continue making New York City a leader in inclusivity and opportunity. I look forward to today's discussion and to finding ways to strengthen our city's commitment to equity and fairness for all. Thank you. I'll now hand the mic over to Chair Lewis.
Thank you, Councilmember. Now we'll hear from Councilmember Hudson.
Thank you so much, Chair Lewis, both for your leadership and allyship, particularly in this moment. I don't need to tell anyone that the federal government is making consistent and aggressive efforts to undermine the rights of the trans community. As a member of the New York City Council's LGBTQIA+ caucus and its former co-chair, I'm proud that this council is matching its solidarity with real action. The legislative package we're hearing today will work to improve standards for trans health care, strengthen privacy measures, protect access to gender-affirming care, and take crucial steps to uphold fundamental human rights at both the city and state level. And these bills will not only protect our transgender, non-conforming, and non-binary neighbors, but will also safeguard all New Yorkers, because when our most vulnerable communities are protected, everyone benefits. Thank you.
Thank you, Councilmember. I will now turn the mic to Committee Counsel to administer the oath to the administration.
Please raise your right hand. Do you affirm to tell the truth, the whole truth, and nothing but the truth in your testimony before this committee, and to respond honestly to council members' questions?
I do.
Thank you.
Sorry, you may begin.
Chair Lewis, members of the Committee on Women and Gender, distinguished members of the City Council and the public, good afternoon. I am Ronald Porcelli, Executive Director of the NYC Unity Project. I am grateful to the New York City Council and the Committee on Women and Gender for hosting this hearing today. The NYC Unity Project is the city's LGBTQ+ interagency coordinating body housed in the Mayor's Office of Equity and Racial Justice. As an innovation hub of novel programming, the Unity Project coordinates across city agencies to incubate culturally competent services tailored to meet the needs of the LGBTQ+ community, particularly TGN-CMB people, people of color, and youth. The Unity Project works across three main sectors: economic mobility, acceptance and anti-discrimination, and health equity. The Unity Project implements programming through a community-driven approach, investing in community-based organizations and developing strategic partnerships across the private sector, nonprofit organizations, and academia. Beyond fostering culturally competent services, the Unity Project focuses on 4 additional pillars: interagency coordination, community engagement and education, policy and protections, and resource access. NYC government has taken enormous strides to uplift and support the TGNC community and the wider LGBTQ+ community. After centuries of discrimination and persecution, the past few decades have seen extraordinary advances in equity for TGN-CMB folks, beginning here at the birthplace of Stonewall, where a rebellion ignited a movement that liberated countless individuals from shame, ostracization, and persecution, both in New York City and across the globe. We have witnessed a profound push for greater rights, protections, and services for LGBTQ+ people. Yet, the work is far from over. We persist, navigating evolving challenges and confronting gaps that remain. We will continue to approach these needs with compassion, commitment, and empathy. We look forward to this hearing, the opportunity to speak before the Council, and candid, thoughtful public testimony. First, with regards to policies and protections, the robust protections of the New York City human rights law prohibit discrimination based on sexual orientation, gender, gender identity, and gender expression in employment, housing, and public accommodations. The law safeguards employment rights related to reproductive health, including gender-affirming care and hormone therapy. To uphold these protections, the New York City Commission on Human Rights, CCHR, enforces the human rights law through a combination of investigations, legal action, settlements, penalties, and public education. LGBTQ+ individuals deserve respectful, high-quality, and culturally affirming health care without fear of discrimination or bias. Knowing and understanding their rights is essential to ensuring they can access care, services, and support. To uphold these rights, the Health Department developed the LGBTQ+ Healthcare Bill of Rights, a critical initiative that outlines local and state protections designed to empower community members in advocating for their health and well-being. This Bill of Rights, available in multiple languages, serves as a tool for awareness and action, reinforcing that healthcare providers and staff are legally obligated to treat LGBTQ+ individuals with dignity and equity. Similarly, the non-discrimination policy of the New York City Public Schools ensures that all students can learn in a safe and supportive environment, free from harassment, intimidation, bullying, and discrimination based on actual or perceived classes, including gender, gender identity, gender expression, and sexual orientation. New York City Public Schools is committed to upholding inclusivity and protecting all students, ensuring that school environments are welcoming to all. To further support TGNC-MB students, the New York City Public School Guidelines on Gender Inclusion provide a clear framework of best practices and protocols for school-based and central office staff. These guidelines help foster understanding, inclusivity, and respect for TGNC-MB students while ensuring they receive the same rights and protections as all students. As part of this commitment, New York City Public Schools mandated that every NYC school must have single-occupancy restrooms available to provide privacy and comfort for students of all gender identities. In the child welfare and juvenile justice sectors, the Administration for Children's Services, ACS, upholds its non-discrimination policy to protect LGBTQ+ youth and families. Its core policy, promoting a safe and respectful environment for LGBTQAI+ youth and their families, mandates inclusive, discrimination-free environments in child welfare and juvenile detention systems. Additionally, ACS provides trans health-related policy and guidance to facilitate affirming health care, including coverage for services not reimbursable by Medicaid. Similarly, the Department of Homeless Services, DHS, policy on serving transgender, non-binary, and intersex clients aims to close service gaps for clients of all gender identities experiencing homelessness, with a focus on respectfully accommodating clients who identify as transgender, non-binary, and intersex. DHS is committed to a policy of respect for all individuals and does not tolerate discrimination based on gender identity or expression. Many members of the LGBTQ+ community continue to face disproportionate rates of HIV and other STIs, making access to affirming and culturally responsive sexual health care essential. The Health Department launched the New York City 2020 Ending the HIV Epidemic Plan, a community-driven roadmap developed through a year-long planning process. This plan guides innovative, equity-focused HIV and sexual health initiatives that address social and structural factors driving disparities. Through community engagement and education, we foster understanding and interconnection between the government and the public, while equipping individuals with the knowledge and resources to build a more supportive society. The city's inaugural TGNC-MB Health Summit, held in May 2024 and organized by the Health Department and the Unity Project, represent a groundbreaking initiative designed to foster collaboration, education, and community engagement to promote TGNC-MB health. The summit serves as a dynamic forum that brings together TGNC-MB individuals, community-based organizations, healthcare professionals, policymakers, and advocates to engage in meaningful dialogue and collective action. The summit spotlights critical issues in transgender and non-binary health, including barriers to care, culturally competent medical practices, and innovative approaches to improving health outcomes. It provides a platform for sharing best practices, advancing community-driven healthcare, and addressing systemic challenges. The Transgender, Gender Nonconforming, and Non-Binary Community Advisory Board, TCAB, operated through the Health Department and supported by the Unity Project, serves as a vital bridge between TGNCMB New Yorkers and the Health Department, ensuring that policies, programs, and services are shaped by those most impacted. Created to bridge community with local government and to address the persistent barriers TGNCMB individuals face, TCAP provides critical guidance on programming, educational materials, marketing campaigns, and clinical services. By fostering direct community engagement, TCAP helps drive meaningful, informed change, making healthcare more inclusive and accessible. To further improve healthcare provision, the Health Department and Unity Project have partnered with Transgender Equity and Consulting Incorporated to develop a LGBTQ+ cultural and competency training for Health Department sexual health clinic staff. The 3-hour training covers language, key health considerations, and best practices for providing affirming care. The Hidden Voices Project, created by the New York City Public Schools Department of Social Studies and Civics, allows students to find their voices in history, including LGBTQ+ historical figures, as they become analysts of the past while making connections to the present. The Department of Records and Information Services operates the For the Record blog, which includes blog posts with primary sources that give an in-depth look at the city's LGBTQ+ history. Additionally, through the Doris YouTube channel, Doris documents historic footage in the fight for LGBTQ+ rights. Annually, ACS conducts its Youth Experience Survey for youth in foster care ages 13 and up. The survey includes questions on sexual orientation, gender identity, and gender expression, aiming to provide services and improve those services for youth. In addition, ACS runs the Youth Leadership Council that places a strong emphasis on the voices of LGBTQ+ youth to empower youth in the foster care system and improve existing services. Cultural competency is further supported through the Family Engagement and Acceptance Training, FEAT, and LIFT programs under ACS and the Unity Project. FEAT provides extensive training for LGBTQ+ mental health clinicians of color to address family rejection of transgender youth. Meanwhile, the LIFT program is a 6-month certification designed to equip social workers with the skills needed to support youth and their families. The Department of Youth and Community Development, DYCD Street Outreach Program, is a vital first point of contact for youth experiencing homelessness, many of them members of the LGBTQ+ community, providing direct education, service navigation, and referrals to essential services. CCHR is deeply committed to community engagement and education. CCHR's lead advisors and liaisons play a vital role in educating New Yorkers about their rights and responsibilities. The Commission also provides extensive training, including Human Rights Law 101 and working with transgender and gender nonconforming communities. Delivery of culturally competent services to TGNC individuals is at the core of our work in addressing disparities facing the community. Ensuring access to high-quality affirming healthcare is essential to the well-being of the LGBTQ+ community, including TGNCMB people. Through strategic investments, we are expanding inclusive primary care, gender-affirming services, sexual health programs, and HIV prevention efforts. The Health Department launched PlaySure Network 2.1, a citywide network of 18 agencies that provide a comprehensive package of HIV and sexual health services in healthcare and non-healthcare settings using a one-stop-shop model. Through the Building Equity, Intervening Together for Health, Be Into Health initiative, the Health Department supports 9 clinics to implement evidence-based HIV care models that address the needs of communities most impacted by HIV. The Health Department's sexual health clinics provide low to no cost services for STIs, including HIV. The Health Department is unwavering in its commitment to ensuring the sexual health clinics offer safe, affirming spaces. The clinics offer STI testing and treatment, expanded HIV services, counseling, as well as vaccinations, contraception, and more. The Health Department's Express clinics provide a fast and hassle-free option for STI and HIV testing with results available in just hours. Beyond medical care, patient navigators and social workers offer up to 12 no-cost counseling sessions, connect individuals to essential support services such as substance use treatment and continued counseling. In 2022, our clinics led the city's response to the Mpox outbreak, providing diagnosis, treatment, and vaccination. These services are integrated into existing clinic workflows. As part of HIV prevention efforts, the Unity Project supported the Judson Pride Clinic, H&H's flagship Pride Health Center, to improve access to confidential PrEP services for patients with privacy concerns. Judson is able to directly dispense PrEP medication, pre-exposure prophylaxis medication directly to patients as part of a confidential visit for sexual and reproductive health care. Judson has also started offering the injectable form of PrEP, which allows patients to access PrEP medication confidentially and without worrying about adherence to daily medication, a barrier to consistent and effective use. Lastly, to further ensure high-quality, affirming healthcare, the Health Department partners with Callan Lord Community Health Center to provide comprehensive services for uninsured LGBTQ+ individuals. These services include primary care to behavioral health care, ensuring that care is accessible, holistic, and affirming. Economic empowerment is a critical pillar of equity, ensuring that individuals have access to the resources and opportunities needed to thrive. We are expanding workforce development programs tailored to the LGBTQ+ community, including TGNC and BI people. Investments in career readiness, job placement, and leadership development are breaking cycles of economic hardship and fostering long-term stability. By prioritizing inclusive hiring practices, workplace protections, and pathways to success, we are building a future where every person can achieve financial security and professional fulfillment. DYCD's SYEP Pride connects young New Yorkers to supportive and welcoming early career opportunities by engaging with employers specifically committed to LGBTQ+ youth through their organizational missions and/or employee resource groups. DYCD works closely with the NYC Unity Project to provide training and programming to providers, worksite supervisors, and participants. SYEP Pride has partnered with a variety of private partners, including Google, Disney Theatrical Group, Louis Vuitton, ABC7, Hermes, Republic Records, Fendi, Playbill, Nordstrom, and others to deliver innovative career exploration, career mentorship, and pride-related events. Supporting mental health, promoting family and community acceptance, and expanding access to affirming care are essential to community well-being. With Unity Project support, Judson Pride Clinic is building and providing more robust programming and helping a greater number of patients access mental health and community support. The work includes peer support groups, mental health and wellness groups, vocational workshops, and staff training and workshop facilitation. In addition, the Unity Project has supported the renovation of the second floor of the clinic's central facilities to create a community space for this programming. The Family Acceptance of LGBTQ+ Youth Initiative, supported by the Unity Project and implemented by the Health Department, is a groundbreaking program dedicated to fostering acceptance for LGBTQ+ youth, particularly TGNC and B youth, among parents, caregivers, families, and community. Recognizing that family support plays a crucial role in the mental health and well-being of young people, the initiative provides resources to bridge gaps in understanding. The initiative offers support groups for parents and caregivers, educational workshops for families, community members, educators, and service providers, and one-on-one counseling and conflict mediation to strengthen families. Additionally, it empowers youth through a filmmaking initiative for individuals up to 21 years old, allowing them to share their stories and experiences through creative expression. Social marketing campaigns further amplify messages of acceptance. By emphasizing mental health, education, and cultural competency, the initiative works to create a more supportive environment where young people feel valued, respected, and loved. The LGBTQ+ coalitions are initiatives supported by the Unity Project and implemented through the Health Department, dedicated to reducing trauma and addressing substance use within LGBTQ+ communities. Recognizing that traditional drug prevention approaches often fail to consider the unique challenges faced by LGBTQ+ individuals, LGBTQ+ coalitions take a community-driven, culturally responsive approach that prioritizes risk reduction and protective factors specific to these communities. The Health Department's crystal methamphetamine harm reduction program provides vital support for men who have sex with men and transgender individuals who have sex with men and who use crystal methamphetamine, offering a holistic, affirming, and non-judgmental approach to care, including supportive services. The Health Department's psychosocial support services for TGNC and B people with HIV supports partners to provide trauma-informed, culturally affirming care, including individualized counseling, connections to HIV care and treatment, and referrals to essential medical and supportive services. Building strong support systems is essential for the well-being of TGNC and B youth, especially those navigating housing instability or food insecurity. Our initiatives focus on creating safe, affirming spaces where young people can access resources, connect with community, and receive support. LGBTQ+ youth comprise approximately 40% of youth experiencing homelessness. DYCD's youth drop-in centers, open to young people aged 14 to 24, serve as safe havens where youth can access food, clothing, showers, laundry facilities, and case management services. These centers also provide referrals to crisis service programming and additional support services, ensuring that youth experiencing homelessness or instability can find the resources they need. DYC's youth drop-in center expansion, supported by the Unity Project, is a transformative progression aimed at providing around-the-clock support for LGBTQ+ youth in need. With the expansion to 5 centers with 24/7 service in all boroughs, this initiative ensures that young people have access to safe spaces, essential resources, and supportive community services at any hour. DYCD's Transitional Independent Living Youth Housing Program, TIL, provides long-term shelter and essential support for youth experiencing homelessness aged 16 to 21, with extended services available for young adults aged 21 to 24 at designated homeless young adult sites. DYCD's Food Assistance Program ensures that food pantries are available in every borough, providing nutritional support to individuals and families facing food insecurity. Lastly, DYCD's crisis service programs offer emergency shelter and crisis intervention for youth aged 16 to 24 and 21 to 24 at homeless young adult sites. These voluntary short-term residential programs provide a safe space for young people experiencing homelessness while working towards family reunification when possible. If returning home is not an option, the program helps youth access its transitional and long-term placements. Underpinning these efforts across the city agencies, the NYC Unity Project runs the LGBTQ+ work group Shaping the Future Together, a collaborative effort to enhance government operations and ensure that city agencies effectively support LGBTQ+ communities. The work group brings together LGBTQ+ liaisons from key agencies to foster interagency cooperation. Through this coordinated LGBTQ+ action group, the city is committed to building a coalition that advances LGBTQ+ representation in government, enhances culturally competent service delivery, and strengthens engagement with LGBTQ+ New Yorkers. Our work would not be complete without promoting access to resources. The Pride and Care Health Resource Booklet, funded by the NYC Unity Project and developed by the Health Department, provides information specifically for TGNCMB individuals. This booklet, available in multiple languages, offers critical information on gender-affirming care, primary care, sexual health, safety tips, and community resources. The Health Department provides essential tools to help LGBTQ+ individuals find knowledgeable, affirming, and LGBTQ+ competent healthcare providers. The NYC Health Maps LGBTQ+ Health Services Directory serves as a vital resource for those seeking safe, accessible, and high-quality medical care tailored to their needs. The online directory features a diverse network of NYC providers. Beyond simply listing providers, the LGBTQ+ Health Services Directory is designed to help individuals make informed decisions about their health care by highlighting providers with a demonstrated commitment to cultural competency and inclusive practices. Additionally, the Health Department maintains a suite of LGBTQ+ web pages that offer health information for men who have sex with men, women who have sex with women, transgender, TGNCMB individuals, intersex individuals, and also suicide prevention resources. These web pages provide affirming and compassionate care guidance, outline healthcare rights, and include resources for individuals and their families to make informed healthcare decisions. The NYC Department of Veterans Services connects LGBTQ+ veterans with services tailored to their needs. This includes specialized caregiver support, discharge service upgrades, medical care access and navigation, support groups, resource access, and navigation of survivor and dependent compensation. In addition, veterans who receive an other than honorable or dishonorable discharge due to their sexual orientation, gender identity, or gender expression may experience a difficulty accessing benefits, including VA home loans, GI Bill educational benefits, and VA health care. DVS helps LGBTQ+ veterans impacted by past discriminatory policies get the benefits they deserve by connecting them to discharge upgrade assistance services. Lastly, the NYC Unity Project website serves as a digital hub for LGBTQ+ New Yorkers. The newly launched digital platform serves as a comprehensive and user-friendly resource hub, connecting individuals with vital services, programs, and support networks tailored to their unique needs. Whether seeking health and wellness resources, legal assistance, housing support, or community building opportunities, the NYC Unity Project website offers a centralized destination designed specifically for LGBTQ+ New Yorkers. The platform ensures that individuals can access the information and services they need to thrive by bringing together citywide initiatives and nonprofit and advocacy organizations under one digital roof. This hub fosters a stronger, more connected community while considering privacy needs. From mental health resources to legal assistance, the website is more than just an information portal. It is a lifeline, a support system, and a multimedia celebration of the creativity and diversity of the LGBTQ+ individuals across New York City. With regards to position on proposed legislation, we are generally in support of the intent behind proposed legislation that offer additional protections to the TGNCMB community. At this time, we, along with our partner agencies, are still reviewing the specifics of the proposed legislation. It will be important to protect the rights of TGNCMB New Yorkers to be free from discrimination and to access care, while at the same time protecting privacy during this volatile time. We would like to have further discussions with the Council to discuss the benefits and limitations of each bill and how we can best address the health and safety needs of the TGNC-MB community. We want to thank the Council for bringing attention to this important topic, and we look forward to working with you. From the first bricks thrown at Stonewall to the policies and protections we fight for today, our work is part of a long legacy. As we reflect on recent progress made and new and ongoing challenges, one thing remains clear: our commitment to dignity, compassion, and support for the LGBTQ+ community, particularly TGNC-MBI individuals. From the dawn of time, TGNC-MBI people have shaped humanities as healers, spiritual leaders, innovators, and more. In New York City, they have played a critical role in shaping our history and culture. In New York City, and throughout all the collaboration with all of our agencies, innovation and continued investment in culturally responsive services, we will continue to build a city where every person is supported and empowered to thrive. By focusing on what truly strengthens our community, we move closer to a future of greater opportunity. Together, we continue our work uplifting New Yorkers.
Thank you for that testimony. We'll start with our questions. President Trump signed several executive orders signaling a change in policy at the federal level to assert there are two sexes and no longer recognize transgender and non-binary people. How has this affected the work of the Commission on Gender Equity, and what changes will the Commission make this year in regards to supporting transgender and non-binary people?
Thank you, Council Member. I want to reaffirm our protections at the city level. This is one of the strongest, if not the strongest, human rights law in the country. In addition to our local jurisdiction, we also exist within the jurisdiction of the state. The state also has a powerful state human rights law. And then in addition to that, the state attorney general has interpreted and enforced this human rights law. And so with regards to New York City, we will continue to enforce these provisions, and we will continue to educate on them so that people are aware of them and the protections that they have at the local level, and then also the protections that they are offered in our wider jurisdiction, the state of New York.
Has the Commission on Gender Equity and the Unity Project seen a change in requested services from the public since the new federal administration came into office?
Yes, thank you for that question. So I want to frame this in the context of we are not new to these challenges. These are challenges that we have unfortunately been facing for quite some time, and absolutely since the time of our immediate local administration. And so this is work that is ongoing. As to regards to increase in services, I think that would be particularly salient for H&H, and I don't want to speak on their behalf, but it is more than likely that people will continue to avail themselves of these services. That is why I also think it is important that people visit the NYC Unity Project website. It includes and is newly updated to include TGNC MBI resources and rights. That includes the city human rights law. It includes different examples on the human rights law, and it includes how to follow up to ensure enforcement. It also includes provisions on hate crimes and a variety of other information, including legal assistance from legal advocacy organizations. So people should absolutely avail themselves of those resources, and I would also say they should avail themselves of those resources before any particular crisis situation. There is no doubt a significant number of resources. It can be challenging to educate oneself on all of them. I would encourage people to familiarize themselves with those resources, to take advantage of them, and particularly to do it before any particular emergency situation. During those times, it's obviously far more difficult to navigate, and so it's truly incumbent that we are aware of our protections and know how to enforce them.
Thank you. One of the executive orders signed by President Trump calls for the ending of federal funding for organizations that support gender ideology or transgender people. What impact will this have on city agency programs, and how will this impact city community-based organizations?
Thank you, Council Member. So that is absolutely a salient issue, and I would say that that is something that we are continuing to navigate. That is not only in this jurisdiction, but that is in jurisdictions across the country. Obviously, these are issues that were relatively anticipated, so we will continue to work through them. I can say that our particular programs, we continue to work at the local level with OMB to ensure that they are resourced, and we continue every single year to assess our needs and to develop appropriate new needs. So that, is, I think, answers your question.
Thank you. I'll call on Councilor Mahani for questions.
Thank you, and thank you for joining us. I know you didn't provide a clear position on the package of legislation. Are you able to talk a little bit about my proposed legislation 1201?
So what I would say to that is we want to continue discussions with you and partner with you to support the bill. As I mentioned, we generally support the intent behind all of these bills. This could not be more pertinent time, so I would like to genuinely express my thanks for the council for all of these proposed bills, for also hosting this hearing. That is certainly something that we would like to continue to have follow-up conversations with you to strengthen the bill and really to engage in that partnership.
Could you share how the administration has enforced the existing clinic access law that applies to the reproductive health facilities?
So I would say, and let me actually point you to some of the recent work that we are doing, because I think that it would interest you. So in response to some of the access to care and safety challenges facing TGNC MB folks in New York City, the Unity Project has funded H&H to develop a coalition of community-based organizations to counter attacks on care. To combat the fear and intimidation tactics that deter individuals from seeking health care, this initiative aims to establish durable, embedded support systems within impacted communities. By partnering with frontline CBOs that serve as trusted advocates, particularly for TGNC individuals, this effort integrates healthcare advocacy into broader community initiatives. Key activities include participating in H&H community advisory groups to enhance healthcare services, visiting H&H clinics serving targeted populations to assess care environments, and then likewise, engaging in peer education sessions to expand awareness of healthcare options and resources.
Which CBOs are funded?
Yeah, that is a great question. So that is currently being contracted with H&H. So when that is available, I'm happy to share that information with you.
And how long has this been, initiative been funded?
So that's something that we're starting now in light of these challenges. And when there is further information, we're happy to share that. It will be on the Unity Project website. Also happy to share that with you, given your interest likely in collaborating with those organizations. And again, this is really in anticipation of some of the challenges, but overall, this is an important effort in ensuring access to care.
What other, Chair, if I could continue my line of questioning, thank you. What other steps is the administration taking in light of our current times?
Yes, I love that question. So as I mentioned before, this is unfortunately challenges that we have been facing for quite some time. So I would reiterate, and I know that this testimony is lengthy, I would also share with you with regards to this testimony that this is essentially a first of its kind historic document. There has never been a more comprehensive compilation of services for the LGBTQ plus community and the TGNC-MB community. So essentially, continuing to implement these services, continuing to grow these services, and then most importantly, continuing to educate on these services. This is why I'm very grateful that you all have called this hearing today. We take numerous different routes to educate the public on these services. Sometimes there's so many services, it can be truly challenging to navigate them, especially the various nuances and how to access that care. And then lastly, I would say we're continuing our LGBTQ plus interagency group. We recently relaunched that late last fall in light of any potential challenges, and that group brings together a number of different agencies. I could rattle them off for you, but GYCD, ACS, DOH, DSS, Commission on Gender Equity, and so on, so that we're partnering across the city, and that is in services, service provision, development of new services, and then community engagement, so that we're getting this information out there and so that people know we support you.
Got it. And then I know you know, this is a comprehensive breakdown of how our city agencies are ensuring inclusivity of the trans community and ways to expand protections within each agency. What is the city doing in terms of just the broader population of New York City as we're listening to fear-mongering rhetoric from Trump to including our leaders here? How are we not just specifically looking at how looking to ensure that trans people receive the care they receive, but how are we also making sure that New Yorkers know that this is a city where we welcome trans people? This is a city where we know not to violate a trans person's rights. Like, what are we doing to like push that home?
And can you clarify, are you speaking like writ large? Or are you
Writ large.
Are you speaking for the TGNC-MB community specifically with that question?
Yeah.
Okay. So definitely with regards to the TGNC-MBI resources and rights, that is a new update that was made on the Unity Project website. We will continue to find ways to share that out and educate for people. It can be challenging when you're faced with some particular crisis. Sometimes you don't know what to do, and you face something that is particularly emotional. It's challenging to navigate. So we have that information there available. As I previously mentioned, I think it is absolutely important that people know your rights and familiarize yourself with your rights. That information is available online. CCHR continues to educate on this, and I think that is more salient than ever. They have a transgender community liaison. They also have an LGBTQ plus lead advisor. And so they're constantly engaging, and that is in a number of different trainings, but also in response to bias incidents, community organizing. There's an upcoming LGBTQ plus iftar where they will at one point also be celebrating, but then also educating people and showing how they can access these sorts of resources. So all of that work is ongoing, and if anything, it is ramping up. These are obviously challenging times writ large. So, in response to that, we're getting to work.
And do you have the data as to like how many complaints were reported through CCHR and what actions? And I only ask this because CCHR is not well funded.
I do have that data. Let me find it for you. Okay. In fiscal year 24, excuse me, 24 cases were filed based on membership of NYC's LGBTQ plus. I totally read that wrong. Excuse me. In fiscal year 24, cases that were filed based on membership of NYC's LGBTQ plus IA communities include 59 cases filed involving gender, which encompasses gender identity and gender expression. This is also a common area of inquiries. So there are 200 plus inquiries that have been related to this subject. And then 24 cases were filed related to sexual orientation. This is also a common area of inquiry with 81 inquiries in that particular case.
And is this like steady, or is this more than the previous year? I'm just trying to understand how our city both is like collecting or being a resource for these kinds of reporting, and also are we reducing the cases and solving the ones that are coming to the agency?
So with regards to that extra follow-up for additional fiscal years and really illustrating that sort of trend that you're alluding to, I would defer to the City Commission on Human Rights. They would be able to provide you that information, and then it would really elucidate what we're seeing. Hopefully we don't see a rise, but you know, obviously that is a potentiality, and so we can definitely connect and showcase that sort of data. And then I would also say writ large, and this is beyond the local jurisdiction, there is a tremendous amount of catch-up that needs to be done with regards to SOGI, that is sexual orientation, gender identity expression data, and so that is an ongoing trend. To put this in the wider context, the conversation that we're having today would have been very different from the conversation 10 years ago and 15 years ago with regards to this entire population. So this is something that I think writ large, and perhaps it's a call to action to academia and nonprofit organizations to really focus on this SOGI data collection and get more information with regards to the community, particularly the numbers that you're looking for.
Got it. Yeah, I would really appreciate that. And I think that information should be made available to us, irrespective of what the political climate is, because this is one of CCHR's like main task, because these protections are in our city, and for us not to notice a trend, or for us to not like really be more proactive, I think is an issue that I have. I want to ask about the denials at the various hospitals, NYU Langone and Mount Sinai. I had heard from families in my district who've had pre-existing appointments. Their appointments were canceled. What steps is the city taking to ensure healthcare providers are not discriminating against patients? And if you could just be succinct, since I have two more questions.
Yes, I will be succinct. So that is obviously a sensitive and challenging issue now. For that in particular, two bodies I would refer to is the City Commission on Human Rights with regards to enforcement there. I would also point you to the State Attorney General's office, who has also opined on this particular issue. And then H&H is doing an extraordinary job to fill the gap here, and they have continued to do an extraordinary job. And so folks can avail themselves of H&H, and then likewise, for concerns, reach out to the City Commission on Human Rights.
So do you know if these families, patients, were able to receive the care they needed? Like, was the administration in touch, given how much of a this was big news in our city, and there was a big uproar.
Absolutely. So with regards to the specifics of that, I can't say definitively, and so I don't want to offer that or offer speculation. My understanding is that that indeed has happened and that those patients have been able to access care at H&H. That is my understanding.
At H&H?
Correct.
Okay. And then, is the administration tracking which healthcare providers within the city are continuing to deliver or resuming delivery of gender-affirming care? I know you mentioned H&H's. What's the funding capacity for H&H? Given, this council, we ask for there to be more H&H facilities and for there to be more funding to H&H facilities.
I share the same commitment as you do. This fiscal year and last fiscal year, I dedicated my entire budget to H&H, particularly the Judson Pride Clinic, which is H&H's premier Pride clinic and renders a significant number of these services. So while I can't speak to H&H's budget, and I don't know if they would want me to in this particular instance, that is definitely a concern, and that is definitely something that we will continue to work through.
And then the state attorney general, state education department, and even the state health department have put out statements making clear that many of Trump's executive orders are, for the most part, not enforceable on their faces, and in many cases contravene not only New York law, but also federal law and the federal constitution, and that New York entities should not be complying in advance. Has our city put out similar statements? Are there statements in the works?
Thank you for that question. I want to acknowledge that question. So what I would say, and I've framed this already, is that these are challenges that have been ongoing, and they will continue to be ongoing challenges, unfortunately, and we will continue to do this work. So I can provide further context, but I will say preliminarily, not only is the work ongoing, not only is it being strengthened, but it is being shared out, and I think that commitment is clearly available. As I mentioned, we just shared out the TGNC MBI rights and resources. It very much coincides quite similarly with the information that was in the proposed bill of Councilmember Caban, and then I could walk you through all of the administration's commitments that have occurred these past 3 years. It would be quite lengthy, and quite much of that is enshrined in our existing testimony. The only other thing I would add to address that question is, in an effort to support the LGBTQ+ community, the mayor signed Executive Order 32 to protect access to gender-affirming healthcare in New York City. The executive order prevents the use of city resources to detain any individual who is providing or receiving gender-affirming healthcare services in the 5 boroughs. Additionally, the executive order denies the use of resources by the City of New York to cooperate with any prosecution or investigation by another individual for providing or receiving gender-affirming care. So
I think the council member's question was, has the administration been vocal? Is there a statement or any information out there about that? I think that's what she's asking. It's a yes or no.
let me say I understand that question, and I want to acknowledge that question. And
So not yet.
so I would reaffirm that we have, through our information that we have shared and communicated, particularly with regards to TGNC, MB rights and resources, we have shared out that information. But I also want to acknowledge the question. I understand your question, and I believe I've answered it.
Yeah, I mean, I think as the city with the most protections, that we still have more to do. And if these other legislative entities have been able to put out statements that show that trans rights will be protected and not weakened, we have a responsibility to do even better. And then as we were doing this back and forth, it really dawned on me that having H&H and CCHR, some of these other agencies, would have been helpful to today's conversation, given you're leading the interagency effort, but then there's like H&H funding, and I'd love to know how many patients they are seeing, and then with CCHR, the kind of they're filling this important gap of people are unlikely to report to, let's say, the NYPD and would rather go to CCHR. And so I'm very curious as to like how those cases are handled. Do we have enough case managers? But that's just one reflection.
Yes, and thank you for that. I totally understand your point. What I would proffer is there is significant benefit to having the NYC Unity Project. This is a very high, broad overview, and as I mentioned, the document, the testimony, is unequivocally historic and first of its kind document. And so while there might not be that particular, there's a number of agencies that would have been highly relevant. This does afford the council the opportunity to see this high-level overview, to hear from the NYC Unity Project. There is no comparative agency to provide this sort of information, this in-depth and this broad across city agencies. So I could have had my fellow government workers here with me, but at the same time, it does afford you the opportunity to ask in-depth questions on these various programs, services, engagement. And then what I would, further add, this document is a tool for you all. This document is a tool for the people in this room. So avail themselves of it, familiarize themselves of it, and then access those resources. The more people access those resources and engage, the better resources that we can render.
Thank you.
Thanks, and it is a robust document, so I thank you for sharing it with us. With so many young people in chambers today, some have come in, some are still here, and with so much uncertainty with the administration, I just have some quick questions regarding some of the bills that we heard today relating to introductions 1200-2025. Are there any obstacles to implementing a public information and outreach campaign for legal rights and resources for transgender and gender non-conforming New Yorkers?
So with regards to that bill, again, I would say we generally support the intent of that bill. Unity Project was not, I believe, a named agency. I don't know if there was a named agency for that bill. I would also say that I believe that the broad intent of this is absolutely essential. I am very much in line with this bill. We can continue to flesh it out, but every single thing that is in the bill is also on the Unity Project website, and I believe, and I've continued to stress throughout this entire Q&A and in the testimony, getting people access to these resources is absolutely essential. Availing themselves of it, there's a lot to navigate, and so having that sort of understanding and doing it before you're in an emergency situation is absolutely essential. We don't create these resources, just for ourselves. We don't exist in some white ivory tower. We are working with the community, and we want people to avail themselves of these resources.
Thank you. Relating to introductions 1202, how has the city responded to the unique needs of transgender and non-binary migrants?
Thank you. Thank you for that question. So with regards to that proposed legislation, all the services that we have mentioned today are available to all New Yorkers.
Okay, and what are the barriers to responding to the needs of transgender and non-binary migrants?
So that is a great question. There's a number of barriers, so I won't wax too poetic on that, but for sure, language access is an absolute issue. Educating people and having them understand that this is available to all New Yorkers. People are frequently concerned about what some of the limits on this is, whether there's what are the potential age limits, et cetera, et cetera, et cetera. And so having people understand, and this is often language that is frequently included in any of those communications, is that this is available to all New Yorkers. And then of course, and this is writ large, educating on these actual services. There's no doubt that the population and the community that you're speaking to, you face a number of challenges coming here, navigating language challenges, so on and so forth. And so, again, familiarizing yourself with really the mountain of services and taking advantage of them.
Thank you for that. And I know the council member already asked a question about Executive Order 14187, but I wanted to know if you could highlight, because you know this is an interagency response, I wanted to know what steps are you aware of that DOHMH has taken to ensure that patients of H&H facilities will be protected in a situation, or if a situation arises? Because that would be reported back to you guys at some point, right?
So with
Data?
regards to that question, we continue to educate on the city human rights law and educate on it with regards to healthcare. When you have such an extensive human rights law, I remember when I was a practicing attorney and I was first introduced to the human rights law, it is quite comprehensive and it can be challenging to understand all the different factual circumstances in which it is applicable. And so continuing to educate on that, particularly in the healthcare context, is absolutely essential. It's not necessarily super intuitive. When there is a lot of text, it takes time. So we will continue to educate on that and continue, obviously, to enforce the city human rights law in those healthcare settings.
Thank you for that. Local Law 30 of 2021 established a Gender and Racial Equity Advisory Board to advise the mayor and council on issues relating to gender and racial equity in the provision of covered health care services and healthcare services in hospitals. The board is required to deliver a report with the result of its review of protocols that hospitals use to address inequity and recommendation measures to address gender and racial equity in hospitals. I'm aware they're not here, but if you could answer regarding an interagency response or what you're aware of, what is the status of the board?
So I cannot speak to that directly. What I would say is Commission on Gender Equity, we work very closely with them. They have been absolutely instrumental partners in furthering the work of the NYC Unity Project, in marketing that work, and educating the public in that work, and doing outreach. So we are absolutely instrumental partners. I am not on that particular board that you speak of, but that is definitely something that I can engage with CGE on. I would also say that CGE is the Unity Project's sister office. We are within the same family, the Mayor's Office of Equity and Racial Justice.
Thank you for that. I don't know if you have one more question. We have a robust testimony.
Yeah,
Public testimony.
I'll ask a final question. This is a yes or no. Does the city uphold existing New York State and New York City insurance health protections for TGNC people?
So I don't know if I can necessarily answer that, particularly if it's in a private context. I would have to follow up with you on that question. I would definitely follow up.
I just want to know if we are upholding the existing medical insurance process to make protections in insurance. I would hope that it's a yes.
That is my
I would hope that it's a
understanding.
yes.
That is my understanding, but I would definitely, before I proffer anything to you, like to follow up on that particular point, and so I could absolutely engage with you. Again, that's my understanding, but I don't want to overstate that without providing further clarification.
Okay.
Thank you so much for your time. We appreciate you. You're dismissed.
Thank you so much, and I will be staying afterwards to hear public testimony. Everything that people share is absolutely invaluable and critical, particularly in this time. You have to lean on and rely on community, so my generous thanks to the City Council, and I look forward to very candid public testimony.
Thank you for sticking
Thank you.
around. I now open the hearing for public testimony. I remind members of the public that this is a government proceeding and that decorum shall be observed at all times. As such, members of the public shall remain silent at all times. The witness table is reserved for people who wish to testify. No video recording or photography is allowed from the witness table. Further, members of the public may not present audio or video recordings as testimony, but may submit transcriptions of such recordings to the Sergeant at Arms for inclusion in the hearing record. If you wish to speak at today's hearing, please fill out an appearance card with the Sergeant at Arms and wait to be recognized. When recognized, you will have 2 minutes to speak on today's oversight topic. oversight hearing ensuring access to support for transgender, gender nonconforming, and non-binary TGNC and B people in New York City, and one of the pieces of legislation being heard today. If you have written testimony or additional written testimony you wish to submit for the record, please provide a copy of that testimony to the Sergeant at Arms. You may also email written testimony to testimony@council.nyc.gov within 72 hours of the hearing. Audio and video recordings will not be accepted. I now call the first panel.
Brian Ellicott Cook, Nadia Swanson, Zephyr Merker, Victoria No, Queen Jean.
Brian, you may begin.
Good afternoon, Chair Lewis, members of the committee. My name is Brian Ellicott Cook. My pronouns are they and he, and I'm the Director of Government Relations at SAGE, the nation's largest and oldest organization dedicated to improving the lives of LGBTQ+ elders, especially those who are TGNB, people who served, and people living with HIV. SAGE fully supports all of the agenda items before the committee today, as those measures are essential to ensuring dignity, safety, and the well-being of trans women, trans men, and non-binary individuals. Across the country, an alarming push to erase our existence from the public is here. There are restrictive laws, rollbacks on our rights, and denials to basic health care, even the policing of how we have the ability to travel and live our lives. SAGE fully supports the ask from the Trans Equity Fund to be raised to $10 million, prioritizing trans-led and trans-serving organizations. We support Resolution 0771, which calls on the governor to sign S929 and A2141, protecting personal information to not just to a privacy issue, it is now an issue of survival. Beyond this specific policy measures, I want to urge the committee to consider renaming itself to better reflect the TGNB community it serves. Language matters, and a more inclusive name would send a powerful message that all gender diverse individuals, especially those most marginalized, that we are seen, valued, and protected under the scope of this committee's work. At a time when our committee faces escalating threats from hostile policies, visibility and inclusion in the institutions meant to protect us is more critical than ever. And SAGE remains committed to working alongside this committee, the City Council, and all of our advocates to advance policies that uplift and safeguard TGNB older adults and the next generation of TGNB New Yorkers. Thank you.
Thank you. Nadia Swanson.
Thank you, Chair Lewis and Councilmember Hanif, for holding this hearing. My name is Nadia Swanson. I use they, them pronouns. I'm the Director of Technical Assistance and Advocacy at the Ali Fernay Center, the world's largest and most comprehensive program for LGBTQ unhoused youth. We support all of the testimony, the hearings and bills and resolutions that are in the agenda today. I'm going to focus on a few key areas. One, seconding my colleague over there, that we support the trans equity funding being increased to $10 million at least, that fund prioritizes trans-led organizations, being the organizations that are going to benefit from that increase, and to also fund technical assistance support for trans-led serving organizations to be able to actually apply and keep up with the rigorous requirements that we have for funding. I would secondly like to speak about trans, runaway, and homeless youth and transitional housing, specifically ages 21 to 24. We operate the only runaway and homeless youth transitional housing program for 16 to 20. It's an 18-bed site. This program has been incredibly successful in providing specialized services led by trans directors and staff to ensure youth are able to graduate to stability after a 2-year length stay. We need a transitional program for 21 to 24-year-olds. 21 to 24-year-old trans youth are our most vulnerable. They are the ones who are at the most risk and the ones who are experiencing the most risky coping mechanisms, and they're left out, especially with our very, very, very long wait lists. They're often waiting 6 months to even get out of a drop-in center. And then I want to focus on OSA's bill, Intro 1203. The mayor's plan for asylum seekers, released in March 2023, left 16 and 24-year-olds out completely and took away the critical access to DHS. Because RHY programs are severely underfunded, we rely heavily on referring youth to Marcia's house, while they wait an average of 6 months to be placed in our housing program. Trans youth leave the Hercs because they don't feel safe and would rather stay in a 24/7 drop-in center, even though they don't have access to a bed due to the no sleep directive in 2023. I'll just briefly name that, I have spoken to the mayor directly. I've spoken to the commissioner of DHS. I've spoken to OASO. I've done testimony all about this issue, and it's been just passed and passed and passed, and I'm thankful for that, this. It needs to happen.
Thank you. Zephyr?
Thank you, Chair Lewis, members of the Committee on Women and Gender Equity, and other esteemed council members for the opportunity to testify. My name is Zephyr Merker Herrera, and my pronouns are they, them, theirs. I am Outreach Coordinator at GMHC's Testing Center. I've been working at GMHC for 5 years, starting in our Transgender, Gender, Non-Binary, and Gender Non-conforming, or TGNC&B hub as an HIV testing counselor. I'm here to update you on GMHC's ongoing commitment to serving TGNC&B New Yorkers, to express our support for the introductions and resolutions on today's agenda. Founded in 1982 as Gay Men's Health Crisis, the world's first HIV/AIDS service organization, GMHC provides comprehensive services to nearly 5,600 New Yorkers living with and affected by HIV and AIDS every year. Our clients represent populations at the high risk of HIV infection. In 2024, on intake, over 78% lived under the federal poverty level. Over 49% of all clients were people of color, nearly 50% were ages 50 and older. 65% identified as lesbian, gay, bisexual, or questioning, and 5% were TGNC&B or questioning on their gender. Given that the New York City's estimate of this population is between 1% and 2%, GMHC is serving a high proportion of our city's population. An example of our reputation as a safe and affirming provider. GMHC's TGNC Hub provides comprehensive peer-led case management and referrals, including to Project Transcend, our support group that provides safe and affirming spaces where clients can feel seen, heard, and valued in a judgment-free and strength-based environment. Project Transcend prioritizes community health by integrating HIV education with trans-sensitive STI testing and PrEP education. It recognizes the importance of communal experiences by hosting catered in-person events. These gatherings foster deeper connections among participants, reducing isolation and strengthening support networks. GMHC is grateful for the opportunity to support introductions 1200, 1201, 1203, and 1204, all of which address critical issues our TGNC&B clients face. A significant proportion are immigrants who fled their homes and countries due to anti-trans violence. We provide them with essential resources, including housing referrals, legal referrals, and immigration support. Continued access to gender-affirming care is critical because it keeps TGNC&B clients in the medical system. When unable to access legal care, they access other sources that increase their risk for HIV through shared needles. I personally recall a client who was diagnosed with HRV, and we linked her to treatment, which was her first opportunity to access legal hormones. Lastly, as a member of New York City's Trans and Queer Advocacy Coalition, GMHC strongly supports the coalition's ask of the council to increase the Trans Equity Initiative $10 million in total funding, with new funds to support trans-led community-based organizations. Thank you again for the opportunity.
Thank you. Victoria?
Hello, my name is Dr. Victoria Ngo. I use she, her pronouns. I am a resident physician here in New York City and a member of my union, the Committee of Interns and Residents, or CIR. Thank you to the committee for holding this hearing and to the council members who sponsored these critical bills and resolutions. I am testifying today in favor of the bills and the resolutions protecting access to gender-affirming care. Before I came to New York, I started my medical training in Virginia, and today I'm thinking of the patients that I met there. I remember my patients who traveled hours to see us for gender-affirming care, and my patients who reached out in fear when our state policies were changing in 2022, and my patients who tried to end their lives when their dysphoria became too much. But I also remember celebrating with my patients when they started the medications they needed, and I remember getting to watch my patients grow into themselves. I ended up coming here to New York to finish my training because I wanted to keep celebrating and caring for my patients in their whole selves. Patients of all gender identities deserve well-trained physicians to care for them, and I knew I would get strong training in the city, and I have. Since coming here, I've taken for granted that this is an environment where I'm able to do life-saving care for patients. I get to celebrate normal milestones with my patients, like when they get to graduate college or get a new job, instead of brainstorming ways to cope with their dysphoria because there's nothing else we can do. In New York, we follow global guidelines and local values because we know our gender diversity makes us better, and we can't let that go. I urge my city council members to protect access to gender-affirming care so that I can keep doing my job, and I hope the council will ultimately and quickly pass these bills and resolutions. Thank you.
Thank you. Queen?
Oh, okay. Oh, John, maybe I can use both. Okay. I push it. Oh, there it is. Hello. Good afternoon, esteemed council. My name is Queen Jean. My pronouns are she and her. I'm the founder and the executive director of Black Trans Liberation here in New York City. And I just want to say a few things. One is that there is an ongoing crisis, as we all are aware of in this month. That's why we're sitting here, violence against transgender people, against New Yorkers. And the city has been able to put together the Trans Equity Fund, and this Trans Equity Fund is intended to support trans community. Currently, in this moment, the Trans Equity Fund is supporting 62% cis-led organizations. That means non-trans-led organizations. That means the trans people there do not have executive power. So that is a crisis and a problem. I am hoping and demanding today that the budget be increased from the 3.4 million to at least 10 million or more. 10 million or more, because we need that funding to actually take care of our people. Our community, they come to us as trans people, they come to us as trans leaders, as trans hubs, as sanctuary safe spaces in order to get salvation, in order to get the resources and the care that we are providing. And a lot of us are providing that out of our own selves, our own resources. So it is imperative that this fund be increased. It is imperative that it is prioritizing, moving forward, trans-led organizations. It is Black History Month. We wouldn't be giving Black money, right, to non-Black organizations. So I think that we just need to be very clear and be intentional in the way that we're supporting our people. And also, in addition to that, is to really reimagine the processes. There's a lot of red tape. There's a lot of, barriers, that a lot of organizations have to try to hop around in order to receive those funds. So we need for those funds to be able to achieve in a very clear and transparent way moving forward. And I also just want to say that it is, at the end of the day, it is trans people that will come and fight for our community. Right. This entire room here is here because we are tired of being waited to be told no. We're tired of being sidelined. We're tired of having to audition for empathy. We're tired of having to prove our existence. If there is money here for our city, we should be able to take that money and to provide for New Yorkers. Right. Shelter systems is not a solution. It is a temporary fix. And lastly, I'll just say, I know that we're at time, but we are not wallpaper. And trans people cannot be wallpaper and be rolled over again and again and again. Thank you. And if you're looking for where that 10 million can come from, you can dismantle the ICE squad. You can dismantle a lot of the NYPD SRG unit. Right? This year, literally $206 million went into paying because of all of the abuse and the terror and the inappropriate behavior, misconduct of the NYPD towards innocent New Yorkers. Right. So that $10 million needs to happen, I believe, retroactively and immediately.
Thank you.
I thank you all.
Submit that in public testimony. I really appreciate the diversity of this panel. There's a physician, I thank you all for your testimony today. If you have additional testimony, please submit it to the Sergeant at Arms or testimony at council.nyc.gov, as well as the budget ask. Thank you so much.
Thank you. And I also, I know people were testifying for more than 2 minutes before this.
No.
Okay, all right,
Okay.
Thank you. Okay.
Thank you. This panel is dismissed. The next panel is Dahlia Abrams, Aspen, Sorian, Jalen Blake, and Julia Davidson. Dahlia Abrams, Aspen, Sorian, Jalen Blake, and Julia Davidson. Dahlia, you may begin.
LGBTQ youth make about 40% of homeless youth, a disproportionate number considering their size in the general population. My name is Dahlia Abrams, and I'm a part of that 40%. From 2018 to 2022, 48 anti-transgender laws were enacted in the US alone. increasing suicide attempts among LGBTQ youth as much as 72%. I'm also a part of that percentage. In New York City alone, 41% of LGBTQ youth seriously considered suicide in 2022, with 12 attempting it. 50% of queer and homeless youth are turned away from shelters due to their sexual orientation or gender identity. The numbers are real and they are rapidly increasing. I live at a shelter, and my staff can barely give us sustainable meals with all of our dietary needs. As someone who has been turned away by shelters from simply being different, I know how painful it is to be rejected for something as basic as who you love and how you identify. It feels like you're being ignored even after telling people who you are countless times. It is time we bring more awareness to the LGBTQ youth homelessness crisis in New York City. But homelessness and mental health struggles aren't isolated issues. They are deeply rooted in systemic inequalities such as lack of affordable housing. We need the New York City government to increase funding for homelessness prevention programs and add policies that expand opportunities for homeless youth in education, healthcare, and housing. We can no longer let this issue persist without action and anything. The real problem isn't these youth, it is the support and understanding that it's the lack of the support and understanding that they face. Please let us work together to fix this.
Thank you so much. Aspen?
Good afternoon. My name is Aspen, and I'm 16 years old. I live in Flatlands, Brooklyn, and Councilmember Farrah Lewis's district. My parents are both proud civil servants. I'm testifying today to ask you to protect trans New Yorkers. I know the city has my back, and the proposed bills will solidify that. I came out as trans 4 years ago, and I've been on testosterone for a year and a half. I'm grateful to receive my care at an adolescent clinic in the New York City health and hospital system, especially considering that 2 private hospitals in our city are currently trying to limit this care for kids like me. Gender-affirming care has allowed me to be more comfortable being myself. I filed for a legal name change last year, and I applied for a new passport before the inauguration with my new name and gender marker. I received my new passport this week, and it says female. The document I received back from the State Department states that information was changed on my application to, quote, correct my information to show my biological sex at birth. This passport does not match my other documents and will make travel significantly more difficult and stressful for me and my family. In a time where the federal government is openly attacking trans people, I want to know that the city of New York is fighting for me, my friends, and my community. I want to be able to worry about normal 16-year-old things, like the SAT I'm taking next week, and not worry about whether or not my doctor is going to be arrested for doing his job, or whether I'll get stopped at the border when I'm trying to go tour colleges in Canada. In the city that the Stonewall Uprising happened, and a city that has continuously fought for equality and justice for all, I urge the City Council to pass these resolutions to protect care for trans kids and adults.
Thank you, Aspen. I'm sorry you went through that experience. I'd love to talk to you more. Sorian? Yes? Did I say that correctly?
Soren, yeah.
Soren.
It's okay. Thank you, committee. My name is Soren Reck. I'm a 24-year-old resident of Astoria, Queens in District 22, and a transmasculine non-binary person who relies on access to gender-affirming care. I'm here to speak in support of increased funding for transgender, non-conforming, and non-binary New Yorkers. It's no secret, obviously, that the rights and liberties of trans people everywhere are under attack under the current federal administration, with many other state legislatures like Texas and Iowa now feeling emboldened to follow suit and escalate. In these terrifying times, it's more important now than ever to ensure that trans individuals can feel safe and supported in New York City. I know firsthand how overwhelming and complicated it is to navigate the legal paperwork to change your name and gender marker on various documents, and I myself have had access to my own gender-affirming care be delayed and denied through different insurances and different pharmacies. But I'm one of the lucky ones who's been able to overcome these barriers thanks to support from my family, friends, and the amazing trans and queer community of New York City. These services are life-changing and life-saving. For those with less access to support and resources, I can't imagine how difficult it must be to try to advocate for yourself as a transgender person in the current political climate. So this is why I want to implore the committee to vote in support of funding public outreach regarding legal services for trans people, preventing interference with providing gender-affirming care, and develop plans both to specifically support young transgender migrants and the health and well-being of all transgender, non-conforming, non-binary, and intersex New Yorkers. Thank you.
Thank you. Jalen?
Hi, I'm Jacqueline Blake. Sorry, I'm losing my voice right now. I use she and her pronouns. I live in the Bronx in Eric Denowitz's district. I am a cisgender heterosexual woman ally to the trans community. During this time, I echo a lot of the sentiments for increased budget for trans-led organizations, as well as bring attention to incarcerated trans and non-binary New Yorkers. Under this administration, people have suffered loss of dignity under this current commissioner. So I thank you for allowing me to participate and speak today.
Thank you for being here. Julia?
Hello, Chairperson Lewis and members of the committee. My name is Julia Davidson. My pronouns are she, her, and I am a cis woman. I was a high school teacher for 7 years, and now I'm in my second year of law school at Fordham Law. I live in Councilmember Hanif's district. Thank you for this hearing and your hard work on these bills. I am a member of Advocates for Trans Law Students, a group of volunteers who help trans and non-binary people fill out their name and gender marker change petitions in civil court. This is the first step in many bureaucratic hurdles. While we have been doing this for almost 3 years, since the election, we have helped 350 people. We are a small team now hosting multiple events per week. The tone of these events have shifted. Once celebratory events where we could help people fill out paperwork, we now spend hours talking about worst-case scenarios. There are so many hurdles to transitioning, whether it is changing identity documents, accessing gender-affirming care, accessing affirming therapists, finding support at work or at school. All of these steps require access to resources, money, and often require taking time off work. Now, with the outright vicious and relentless attacks coming from the federal government and those that support it, trans and non-binary people need our open and loud support more than ever. When I offered to meet people who wanted to testify today, a few trans people told me that they were too nervous to go on public record. In order for our democracy to work, all people need to feel safe enough to come to a public hearing and share their experience without fear of retribution. I hope City Council passes these bills and resolutions to support our trans, non-binary, and gender non-conforming community members, especially Council members Hanif's bill. I hope that cis people across the city will stand up loudly and declare that they will not tolerate this kind of hatred and abuse coming from our government. And I hope that cis women like myself will stop allowing transphobic rhetoric to spread under the guise of so-called protecting women. Thank you for your time and attention.
Thank you so much. Do you have questions for the panel? Thank you all for being here. This panel is dismissed. The next panel, Tiffany Jade Monroe, Kimberly Joy Smith, Catherine, Jasmina, and Mason. Tiffany, you may begin.
Is this on? Awesome. Dear Chair Lewis and the Committee on Women and Gender Equity, thank you for holding this critical hearing on women and gender equity. Today I testify before you about a crucial issue, ensuring that gender-affirming care is protected, accessible, and covered in the same manner as reproductive health services. This is at the heart of Intro 1201-2025, the AFFIRM Act, guaranteeing transgender New Yorkers equal access to healthcare without fear of discrimination or criminalization. My name is Tiffany Jade Monroe, and I am the Trans Justice Coordinator for Caribbean Equality Project. We are a Caribbean LGBTQ+ immigrant rights organization. CP works daily with transgender and gender nonconforming migrants and asylum seekers, witnessing firsthand the barriers they face when seeking gender-affirming care. These challenges range from systemic discrimination in healthcare settings to insurance denials and the constant threat of harassment and violence. The AFFIRM Act is critical because it removes legal and institutional roadblocks that prevent TG and CMB individuals from receiving essential medical care. By explicitly including all forms of gender-affirming care under these legal protections, this bill ensures that individuals who experience interference can seek legal recourse and hold perpetrators financially accountable. This provision is a game changer in reaffirming a person's right to health care and deterring those who seek to obstruct it. For the LGBTQ+ immigrant community we serve through our health navigation programs, these protections are life-saving and life-changing. I call on the City Council to pass the Affirm Act to strengthen a healthcare system rooted in diversity, equity, and inclusion, all New York values. We also stand in solidarity with trans-led and serving BIPOC organizations to call for an investment to increase the Trans Equity Initiative funding to $10 million. And I will say it is time to protect trans healthcare and trans youth and defend our dignity and rights. This City Council must put an end to harassment now by strengthening legal protection and access to gender-affirming care across New York City. Thank you.
Thank you. Kimberly?
Hi, good afternoon, Chair Lewis and committee members. My name is Kimberly Smith. I use she and her pronouns. I am the Executive Vice President for Policy and Advocacy at Callan Lord Community Health Center. Callan Lord provides quality health care to over 22,000 LGBTQ+ New Yorkers, including more than 8,000 transgender, gender nonconforming, gender nonbinary, and intersex patients. Many of our patients face systemic barriers to healthcare, housing, and economic stability. Today, I want to address the urgent need to protect trans healthcare access. Our patients are experiencing fear and anxiety due to escalating attacks on their rights. Recent executive orders that were referenced earlier, while not binding law, threaten gender-affirming care and bodily autonomy. The EO around protecting children from chemical and surgical mutilation threatens changes to Medicare and Medicaid conditions of participation, which could bar providers from federal programs if they offer gender-affirming care at any age, for any age. Such actions would devastate healthcare institutions like Callan Lord, serving marginalized community, worsening health disparities, and increasing suicide and violence risks. Despite these threats, Callan Lord remains steadfast in its commitment. We remain open and have not changed any of our services. To safeguard trans healthcare in New York, we urge the City Council to increase the existing Trans Equity Initiative to $10 million, prioritizing BIPOC and trans-led organizations. We also support the package of bills that was recently introduced and urge the City Council to fund a new City Council initiative to ensure ongoing access to gender-affirming care at community health centers in New York City. We urge you to support statewide efforts to establish a $50 million contingency fund to replace potential Medicaid cuts for gender-affirming care. And we urge you to support legal protections for gender-affirming care through state law to shield providers and patients. Additionally, we want to support the proposal to consider renaming this committee, and will submit lengthier testimony if you have any other questions. Thank you.
Kimberly. We'll hear from Catherine. No, Catherine. Jasmina.
Good afternoon to the Committee on Women and Gender Equity. My name is Jasmina Salmova, and I'm here on behalf of Quadir Coles, who is the Director of Policy and Advocacy at Girls for Gender Equity. GGE is an intergenerational organization based in Brooklyn, New York, founded in 2001 on the principle of advancing equity in sports for girls and gender-expansive youth. Since our founding, we have expanded our mission to challenge structural forces, including racism, sexism, gender-based violence, transphobia, and homophobia, which construct the freedom, full expression, and rights of all young people. We do this work through direct service, policy advocacy, and cultural change. We are here today to urge this committee and the full City Council to reaffirm your commitment to protecting, supporting, and expanding access for transgender and gender nonconforming people, especially youth in New York City. At a time when trans rights are under relentless attack across the country and from the highest level of government, it is important that our city remains committed to ensuring that all young people, regardless of their gender identity, are able to exist, express themselves fully, and thrive. Protection for trans and gender nonconforming youth begins in schools. The Department of Education has issued guidelines to support trans and gender-expansive students to ensure that every student has the opportunity to learn, grow, and thrive in a safe environment. Additionally, there are legal protections to prevent discrimination in employment, housing, and other essential services. However, despite the local work done to shore up protections and create equitable opportunity, federal efforts threaten to erase the existence of trans people and roll back the existing safety nets, putting young trans and gender nonconforming people at risk of harm. We are already seeing this influence play out in our local schools, where policies targeting trans youth, particularly in sports, seek to exclude them under the guise of fairness. These efforts do not protect anyone. Instead, they reinforce harmful stereotypes, fuel discrimination, and further isolate trans youth, many of whom are already navigating hostile environments.
You could wrap.
All right. We have a list of asks that we'll be following up with, but our main one is asking for the Trans Equity Fund to be increased to $10 million. Thank you for your time.
You got it all done. It's okay. Mason?
Good afternoon, and thank you for the opportunity to testify today. My name is Mason Crawford. I use he, him pronouns, and I'm a harm reduction coordinator at Safe Horizon Streetwork Project, and I have submitted my full written testimony today. Safe Horizon is the nation's largest nonprofit victim service organization, helping 250,000 New Yorkers each year who have experienced violence or abuse. And I'm honored to testify on behalf of Streetwork Project, which has been a steadfast advocate and service provider for transgender, gender nonconforming, and non-binary New Yorkers for decades. At Streetwork Project, we provide a safe, inclusive, and affirming environment where TG and CNB individuals can access essential services free from judgment and discrimination. Our drop-in centers and shelters are built on the principles of harm reduction, trauma-informed care, and unconditional affirmation of identity. Our one-stop shop model is designed to remove barriers from TG and CNB individuals often face when navigating traditional service systems. We ensure that multiple services are available in one location, reducing the need for clients to move through multiple agencies that may not understand or respect their identities. Streetwork has also launched a harm reduction peer internship, a cash stipend program that empowers young people to engage in critical community outreach, educating the community on Narcan, facilitating syringe exchange, and offering safer use kits. This initiative is specifically designed for young people with lived experience, including past or current substance use, sex work, and involvement with legal systems. Beyond providing direct service, we cultivate joy and community through affinity groups and cultural celebrations. Often one of our most cherished events is our annual Kiki Ball, where our clients can freely express themselves in a space to honor their history, artistry, and resilience. Streetwork Project is committed to standing in solidarity with TG and CNB New Yorkers now and forever. We urge the Council to invest in affirming housing solutions, expand access to gender-affirming care, strengthen legal protections, and support community-based initiatives that uplift TG&C individuals. Safe Horizon supports the package of legislation on today's agenda. We need our city leadership to step up and stand against violent, hateful, transphobic rhetoric and policymaking coming out of Washington. Thank you.
Thank you. Thank you to this panel for being here today. You're dismissed. Now we're going to call on the next panel, Alyssa Lamb. Excuse me if I butcher your name, Joyati Ray Chaudhry. Debbie Ray Chaudhry. Okay. Michael and Christine. And we'll start with Alyssa. Thank you.
Hello. Hello, Chairperson Lewis and members of the committee. My name is Alyssa Lamb. My pronouns are she, her, and I live in District 38. I have a trans son who's a junior in high school. He's 16, and I came here today because I'm terrified for his future and for the future of all the LGBTQ plus youth and adults who are right now in danger of having their human rights taken away. So I support all the bills and resolutions today, and I just wanted to speak a little about why. Since he transitioned at age 11, or began transitioning, my son has become a happy, thriving human being. He plays in a school jazz band, he goes out for falafel with his friends, he loves cats, and he loves cat videos. He wants to be a musician when he grows up. He would not have had such a smooth and easy transition if not for the laws and protections that exist in New York City right now. Because of the way the NYC DOE and his teachers made it no big deal to change his name and pronouns, the way he had access to the medical care he needed with no judgment, and the way the city made it easy to change his legal documents without a hitch. He was able to become the person he always knew he was. I guess the bill that I find most urgent today is the one sponsored by Councilmember Shanif regarding gender-affirming care, because I witnessed what happened just last month when hospitals and clinics in New York some of them stopped providing health care to transgender youth, even for a brief period. Some of them have not fully resumed it. families were thrown into despair, and kids had to be told that the care they need in order to be happy and healthy was not going to be provided for them. It would be devastating for my son. It did not happen to us yet, but we're waiting for the day when our clinic calls to tell us that he can no longer receive care because of the executive order. We've strongly considered leaving the country if that happens. Thank you.
Thank you for sharing. Joyari. Can you pronounce it for us?
Turn this thing on. Joythi.
Joythi.
Hello, Chairperson Lewis and members of the committee. My name is Joy Theory Chaudhary. My pronouns are she, her. I lived in the North Bronx for many years. I'm here because I'm the mother of a young trans woman who grew up and went to school in New York City. I'm here to express my support for the resolutions and bills before the committee today. I'm sorry, because I understand that they will protect and support our trans New Yorkers, especially our trans kids. My daughter came out to me as trans about 10 years ago. That was an extremely scary and lonely time for her and for me. So scary for her that she did not even know if her own mother would be supportive, and scary for me because I did not know how to protect her and how to find the support she needed. I thank God that we lived in New York City and I was able to find a group of supportive families and trans kids that we met with regularly. Those parents helped me find the invaluable resources I needed to help my daughter. She attended a high school where she was able to be her authentic self. She found friends, and I found a community that understood our challenges. It was a long road, and I was so grateful that we were able to find a hospital in New York City that provided her with the care she needed to make her physical and emotional transition to her authentic self. Today, she is in graduate school and making her way in this world. I think I can safely say that she has found her way and that she will be a successful, happy, contributing member of our society. If New York City was not the safe, supportive place that it was then, I'm not sure that she would be the person that she is today. Trans kids are kids like any other kids. They need our protection and support to grow up and thrive. New York City was a safe and supportive city for my daughter to grow up, and I want New York City to remain a safe and supportive city for other trans kids and their families. That's it.
Thank you for being a brave mom. We appreciate you.
Hey,
Debbie?
can you hear me? Hi.
I'm supposed to.
Oh, yours going next?
Yes.
Oh, sorry.
Okay.
I didn't know it was that.
Thank you to the City Council for this opportunity to speak and be heard. My name is Debbie Rai Chaudhary. I'm an artist, musician, mother, and a lifelong lesbian. I'm also Joyti's sister, so her daughter is my niece. I've lived in New York City since 1990. Before I moved to New York, I lived in another city with a long history of LGBTQ activism. That city was Berlin, West Germany, because the wall hadn't come down yet. It's still West Germany. Along with LGBTQ activism, Berlin has a history of fascism and counter-fascism. Writers and thinkers, artists and musicians are all drawn to that city as much as we are to New York. I am compelled to speak out because I see the attacks on trans people and immigrants as the reemergence of fascism in the US. Bills like the Affirm Act show the federal government and the world that we are a sanctuary city that supports all people who make up this vibrant community. Particularly, we support the most vulnerable people in our community. Trump's unconstitutional executive orders are characterized by a bare desire to harm. A man who has never served in any military role seeks to erase the existence of transgender service people. He singles out transgender youth for his vitriolic attacks, endangering youth who often suffer rejection at the hands of what should be sources of support: family, peer groups, healthcare providers, and teachers. This cruel attack against transgender people opens the floodgates of hate. The confidential nature of a doctor's relationship with her patients is summarily violated, as well as the ability of parents to take care of their children without undue government interference.
If you could wrap it.
This is nonsense. To which we say, not today, not now, not ever. Thank you.
Thank you. Michael?
Thank you. Sorry for stepping in. All right, thanks committee for having me today. My name is Michael Jarvella. I'm a dad, cisgender dad, heterosexual. I'm still married. My wife, Carrie Keenan. We've lived here for 35 years. I'm the parent of 2 kids. My 19-year-old is trans. My 17-year-old is just a cisgender girl. They're both living thriving, happy lives. And I am in definite support of all the proposals and resolutions today, mostly because of gender-affirming care. Our journey, when it started, as parents, we needed advice, and we needed good advice. And thank God we lived in New York because we got it. New York had the doctors we needed. I can't even say enough good things about all of the doctors that we've had through the years. We got support, we had support groups, and after going through this journey for more than a decade and seeing a child that was insistent, consistent, and persistent, the doctors were incredibly careful. They were very cautious, and the parents, we were all scared. Speaking just for myself and my wife, we were terrified, and thank God we got the help we needed. So what I'm very concerned about is that we're not being quite loud enough about holding the hospitals accountable, world-class hospitals. NYU Langone is a world-class hospital that is discriminating, which is a bit shocking to me, and doing something that's illegal. So I know the doctors that we encountered had a commitment to providing healthcare based on medical necessity rather than political pressure. I'm a little bit shocked that somehow we're allowing hospitals to do the exact opposite. Thank you for having me.
Thank you, Michael. Christine?
Good afternoon.
Oh, turn on your mic.
Good afternoon. There we go. My legal name is Christine DeCalandria, but you can call me Deco. I use they, them pronouns, and I support all of the bills on the docket today. And don't mind these crutches. I'm fine. That's just what I get for playing rugby 20 years ago like every other gay kid. I mean, you can't see me standing, but I'm 5'3" and weigh 100 pounds. But it was totally worth it because that college rugby team was the first place I felt safe to come out. You see, I grew up in a blue-collar, conservative Catholic family in Ridgewood, Queens, and when I was in middle school, I remember asking my dad what it meant to be gay, and he said it was disgusting. When I started going out with a girl in college, I didn't tell my parents about her. In fact, I didn't come out for 2 years. I waited until the night before I graduated from Yale University because as the first in my family to go to a 4-year college, I thought that was the moment they would be proudest of me. And still, I remember my dad yelling at my mom on that phone call and telling her it was her fault for not wearing enough dresses around me. Speaking of dresses, when I started teaching 18 years ago in New York City public schools, I didn't know what to wear. All the men wore ties and all the women wore blouses, so where did that leave me? And then when I cut my hair, my assistant principal demanded to know who all the gay teachers were in a faculty meeting. When queer students were being outed forcibly by administrators to their parents and they came to me for help, my principal told me that if I started a gay-straight alliance, I would be, quote, out by June. When I put on my first tie in the classroom, my dad saw a Facebook picture and said it was the ugly of my students. When I started wearing suits to work and told them it wasn't Miss DeCalandria anymore, it was just Deco, they didn't blink. Kids in New York City stood up for me 20 years ago when I came out as trans, and now I'm standing up for them. One last thing, to all of the queer kids here today who are speaking, thank you for being here, for sharing your stories. We see you, we hear you, and we will fight for you. Thank you.
And we see you too. I want to thank all the parents, guardians, the aunties, everyone that's on this panel for your strength and your commitment to your children. Thank you so much.
Thank you.
This panel is now dismissed. The next panel. Next panel, Diana Adams, Ethan Lynn, Julia Castronovo, Vladimir Martinez, and Puham. Diana Adams, Ethan Lynn, Julia Castronovo, Vladimir Martinez, and Puham. We'll start with Diana Adams.
On? Okay. Thank you so much to the committee and good afternoon.
Yes, that's you. Yep.
My name is Diana Adams. I use they, them pronouns, and I am the executive director of the Chosen Family Law Center, an organization that provides one of the most expansive trans legal services programs in the city, including trans-affirming medical advance directives and healthcare proxies to prevent discrimination in medical environments. And I'm here as a New York City lawyer for nearly 20 years and as a non-binary transgender constituent in Councilmember Hanif's district. And I'm here to urge you to pass this entire raft of bills because they're critically important. I'm very grateful to committee counsel, which have listened to advocates like us. I've been in communication with them over the past month, providing resources and input on trans safety and sanctuary bills. And I'm available for further questions today or in the future. And many well-intentioned trans sanctuary and safety bills are vague and performative. And that's also important because it's important to make a statement that you're standing up and will be keeping people safe in your city. But these bills are specific. These bills are specific in terms of funding and the remedies and the departments that are directed to provide support. And that's critically important because that allows advocates like us to know which departments to go to make sure that those departments are providing that support. This gives remedies. I want to thank all of you for the care and the detail that went into this and celebrate that these would be the most protective and supportive municipal trans laws in the United States and the world. And I want to celebrate that today because I'm hopeful that the council will pass these bills. And I can attest that our clients are terrified. Clients in New York City are having their passports seized when they send them in to get a gender change. And those that sent them in before executive orders, now they've been seized indefinitely, which is menacing and terrifying for trans people, in addition to the fears about not being able to access needed medical care. So there's a climate of terror, and these bills would stand up for New Yorkers in a way that New Yorkers deserve. We have the highest population of LGBTQ people in the country, and we're a beacon, and we deserve these bills to stay a welcoming beacon for our communities.
Thank you. Now we'll hear from Ethan.
Oh, sorry. Hi. Good morning, City Council. I'm Ethan Lin, he, him, attorney with the LGBTQ Law and Policy Unit at the Legal Aid Society. The federal administration threatens to revoke federal funding for providers offering gender-affirming care to individuals under 19. We urge the council to pass 3183, a bill aiming to address health disparity between TGNC, NBI, and cisgender New Yorkers, with amendments requiring an urgent funding analysis to ensure contingency funding is available should Medicaid coverage be revoked, and to ensure dedicated funding to gender-affirming healthcare for TGNC, NBI youth in ACS custody. Regarding correctional facilities, the federal administration threatens to strip protections for TGNC and NBI people under the Prison Rape Elimination Act. Now, more than ever, New York City must act to protect the rights of TGNC and NBI people in New York City jails by aligning the Department of Corrections policies with New York City and New York State's human rights laws. Currently, New York City's jail's failure to properly house many TGNC and NBI individuals in gender-aligned facilities has led to an alarming rate of violence and sexual assault. We urge the Council to pass Intro 625-2024, requiring the Department of Correction to house TGNC and NBI people according to their gender identity or where they feel safest. This bill establishes clear, enforceable guidelines prohibiting placement based on anatomy or other discriminatory factors. Regarding workplace discrimination, due to the federal administration, EEOC cannot be relied upon to enforce anti-discrimination laws protecting TGNC and NBI people. Meanwhile, the CCHR has been in crisis and unable to mediate in a timely manner. We urge the Council to expand public education efforts to ensure workers understand their rights under New York law and strengthen enforcement mechanisms. We support Intro 1200 with modifications to strengthen its efficacy, such as requiring clear timelines and outreach methods. Finally, knowing your rights is not enough if you can't get resolution. We urge the City Council to increase funding for the New York City Commission on Human Rights to hire more mediators to reduce backlogs in discrimination case processing. Thank you for your time.
Thank you. Julian?
Hi, thank you. Good morning. My name is Julian Castronovo. I use they, them pronouns, and I'm the supervising attorney of the LGBTQ HIV unit at Brooklyn Legal Services. Our small unit of 7 legal workers provides free, holistic, civil legal representation to hundreds of low-income, transgender, and non-binary New Yorkers a year. Our unit is a generalist practice, meaning we often represent clients in several different civil legal proceedings at once. We file discrimination cases, defend against evictions, sue for repairs, appeal wrongful denials of gender-affirming care and public benefits, and we help clients obtain reasonable accommodations, name changes, and affirming identity documents. While our model is incredibly effective, we are unfortunately one of only a few legal services providers in the city that provide holistic, direct civil legal services to trans folks. Our unit has been overwhelmed with requests from trans folks for know your rights information and legal services. We are watching many organizations within the city comply in advance with transphobic and hateful executive orders, even when their compliance makes them liable for discrimination under the city and state human rights laws. We are finding that even when we counsel our clients on their rights and they then assert those rights, they often are coming back to us letting us know that the entities didn't care about their assertion of their rights, leaving us to have to file discrimination cases on their behalf. Thus, it is no longer enough to have rights, know them, and assert them. People must be given the enforcement mechanisms to force these institutions to respect their rights. Unfortunately, enforcing rights is difficult. It can be next to impossible to bring a discrimination case without an attorney, as the process is complicated and oftentimes especially traumatic when you're navigating it on your own. At the same time, access to an attorney, especially attorneys who have specialized knowledge on trans discrimination, is limited, as we are one of the few organizations funded to bring these types of cases. Funding that under this administration is at grave risk. Thus, as the City Council continues to pass needed legislation enshrining trans people's rights to self-determination, we urge you to also focus on pathways for people to enforce these rights. One such pathway is the Commission on Human Rights. We similarly have found that we have had extremely long delays. We have one case that has been pending. It's a trans discrimination case since 2020. Multiple attorneys have been assigned to the matter. It cannot be found despite all of our advocacy. So we hope that the City Council will also support a funding and increase resources to the City Commission on Human Rights that allows for more humane processing of these oftentimes really traumatic complaints.
Thank you. Vladimir?
Good afternoon. Thank you, Chair Lewis, Councilmember Hanif, and colleagues in the advocacy space for the opportunity to testify today. More than ever in the recent past, this is an important conversation that New York City can and should lead the nation on. My name is Vladimir Martinez. My pronouns are he and him, and I am the Director of Policy and Government Affairs at the Lesbian, Gay, Bisexual, and Transgender Community Center, or the Center, located on West 13th Street. New York City's LGBT community formed the center in 1983 in response to the AIDS epidemic, ensuring a place for LGBTQ+ people to access information, care, and support that they were not receiving elsewhere. Now, we are the largest LGBT multi-service organization on the East Coast. In 2024, we served almost 700 TGNC community members across our social support services. I'm submitting our full testimony for inclusion as part of the hearings record, where we outline more about our services, respond to today's bill package in detail, and make recommendations about the city's course of action. But I want to focus my brief remarks today to call on the City Council to do a few important and timely things. First, we call on the City Council to invest in TGNC leaders and services. The Center joins all the calls that have been made today for the expansion of the Council's Trans Equity Initiative this year. We call on the Council to increase that initiative to at least $10 million and to prioritize new initiative spending on trans-led grassroots organizations that are serving New Yorkers and that are leading the way on achieving justice for trans people in New York City. The Council should work with our coalition and with trans community leaders to review and analyze the current beneficiaries of the trans equity funding and to promote equity in that context. Number two, the New York City Council, well, that was faster than I wanted it to be, but The last thing I will say is we are calling on the City Council to just use its bully pulpit in this moment to express public solidarity for TGNC people. That is one of the important ways that the City Council can support trans people by making real the lives, the tribulations, and the dreams of trans New Yorkers for their neighbors. I'll submit the rest for the record. Thank you.
We appreciate that. Thank you all for being here and for testifying. We appreciate you. Last, we're going to hear from Poonam.
Yeah, Poonam.
Poonam, okay.
Poonam Srivastava. I come to you as a New Yorker, as a lesbian, as a disabled person, as someone who has watched our country for the last I'm 63, so let's say 55 years, okay? Corruption follows money. That's the history of our country. Corruption follows, we are jumping, every person in this country, in this city, deserves fair and honest care. But take a look at medical care. Remember OxyContin. Remember lobotomies. There are people who are very concerned that the direction of transgender care is not where it should be. There is a lot of money being made and a lot of money that is going without enough knowledge. In England, they have turned back. In Scotland, they have turned back. The Tavistock Clinic has closed. The Tavistock, the Stonewall has been sued, etc. There is reason for us to go slow. A woman named Jamie Reed was a whistleblower down in one southern state I can't think of right now. I did not come prepared to speak, but this is a place of safety and other voices need to be heard. I love everyone. Everyone deserves rightness, but let's keep in mind history and money corruption.
Thank you. Thank you all for being here. This panel is dismissed. The final panel, Sam Scaler, Alana Daniels, Ro Pena, Sharon Leslie Brown, Raul Rivera. Okay. We'll begin with Sam.
Good afternoon, Chair Lewis and members of the committee. Thank you for the opportunity to speak today. My name is Sam Scaler. I use she, they pronouns, and I'm here on behalf of the New York City Alliance Against Sexual Assault in strong support of the measures before you. Attacks on gender-affirming care and trans rights increase the risk of sexual violence, making it critical for New York City to stand firm in protecting trans and gender-expansive communities. The Alliance works to prevent sexual violence through education, advocacy, and policy change. We've seen firsthand how transphobia leads to harm, knowing that 1 in 2 transgender or gender non-conforming person will experience sexual violence in their lifetime. As the federal government erases data on gender-based violence, the full scope of this harm is even harder to measure at this moment. To truly support trans youth and adults, we must invest in community-led programs. To make this happen this budget season, we have been requesting Project DOT, our youth engagement programming, needing assistance, and an increase from $100,000 to $125,000 to expand our support for gender-expansive LGBTQ+ community. The second is the Sexual Assault Initiative, requires an increase from $2.075 million to $2.5 million to meet the rising needs of survivors at this really volatile time. Also, our Outsmart New York City program needs $300,000 to expand sexual violence prevention in nightlife spaces, particularly in LGBTQ plus spaces. And lastly, we echo all of the other testimony for an increase in Trans Equity Fund to $10 million, with specific provision that this money goes to trans-led organizations more than cis-led organizations. The recent murder of Sam Norquist, a Black trans man in New York, who was brutally assaulted before being killed, is a devastating reminder of the chain of violence that begins with transphobia, escalates to sexual violence, and too often ends in murder. When trans adults are murdered, it sends a terrifying message to the trans youth that we work with. By centering and protecting trans people in our policies, I urge the council to support these legislative measures and take a clear, unwavering stance in defense of all trans and gender non-conforming New Yorkers. Thank you.
Alania?
Yeah, Elena.
Oh, Elena Daniels?
Yeah, Elena, thank you.
My apologies.
Nope, you're good. Good afternoon, Chair Lewis and members of the Committee on Women and Gender Equity. My name is Elena Daniels, and I'm a proud neurodivergent, lesbian, non-binary trans woman. I'm also the co-founder and executive director of Transformative Schools with Ro Pena. TFS is a school for building trans power. We do this by cultivating a network of trans people through our work developing trans teachers, teaching trans kids, researching with trans communities, and organizing for trans rights. For a year, we've been organizing in partnership with ACT UP to demand that City Education Council number 2 rescind the hateful Resolution 248. Since December, when the parents of some of our students first came to us saying that trans youth were losing health care at New York City institutions, we've been organizing around this issue, and we're the ones who brought the parents to the reporters who broke the story. Earlier this month, we partnered with ACT UP and Gender Liberation Movement to run the Rise Up for Trans Youth rally, where 7,000 people gathered in Union Square, and 7 of our students, 3 of our parents, and 2 of our teachers were speakers. We're so excited about the energy for trans kids and trans people, and all of the legal and policy efforts on our behalf, like this hearing. However, this also brings me to the problem. We're currently in a situation where we've got a bunch of cis-electeds, cis-advocates, cis-led organizations, and cis people with other positions of power making decisions that impact trans lives. That is to change. Last week at Comptroller Lander's Trans Roundtable, the trans executive directors of Advocates for Trans Equality, Black Trans Liberation Kitchen, GLITZ, New Pride Agenda, New York Transgender Advocacy Group, PFLAG NYC, Trans Latinx, and Transformative Schools came together to say, and supported by Ali Forney, came together to say, we already did the policy work. It's the policy memorandum and the Pride and Policy report. We already did the roundtables and photo ops. We've already applied for funding. We warned the city and the cis-led orgs that these attacks on trans people, especially those who are multiply marginalized, were coming, and we're tired and more at risk than ever before. We believe that trans people know more about transphobia and how to end it than cis people because we live it every day. And so I want to reiterate that we have one and only one focus for today: ensuring that trans-led programs receive enough funding to sustain and grow our work, caring for our communities. Because currently, out of a New York City budget of $111 billion, only $3.2 million goes to the Trans Equity Fund. And of that $3.2 million, 62% of it currently goes to cis-led organizations. After years of asking and years of promises, in fiscal year 25, none of the trans-led orgs were added to the Trans Equity Fund, and instead 2 cisgender orgs were added. And so trans people need to be leading this process. And so to end with the 3 demands to please increase the Trans Equity Initiative to $10 million, at least for 2026.
Thank you so much. You can submit the rest. Thank you. Ro Pena? Thanks.
Hello, members of the committee. My name is Ro Pena. I'm a non-binary educator and co-founder and director of programming at Transformative Schools along with Elena, where every day we facilitate a free trans-centered after-school program for youth who are seeking safety and community with other youth just like themselves. However, we can't do this work without a roof over our heads and the necessary funding to support our educators among so many other financial needs. I'm here today to address the allocation of funding for organizations that support our larger transgender community. Trans organizations have a profound insight into the barriers that trans people encounter, from healthcare access to discrimination in employment and education. When we invest in trans organization, we empower those who have lived trans experiences and are committed to fostering change for their larger community. While most LGB organizations have valuable contributions, they often lack the same level of understanding and care. By investing in us and directing funding towards trans-led initiatives, we ensure that the voices of trans individuals are prioritized, and we move towards dismantling the systemic barriers that have marginalized transgender individuals for far too long. Sure, this is about financial support, but it is also about recognizing the importance of representation and inclusivity in the services provided by trans-led organizations. We need Trans Equity Fund to be increased to at least $10 million. This is a critical opportunity for this council to make meaningful action and demonstrate a commitment to equity and inclusion for transgender people. TFS passionately believes wholeheartedly in the urgent need for trans liberation. It is not just a matter of support, it is a call to action. We advocate for the direct distribution of resources and funding to trans-led organizations. Our organizations are lifelines, offering hope in the face of adversity. We urge this committee to consider the profound impact that funding trans-led organizations can have on our city. Together, we can create a more inclusive and equitable community where every individual can thrive. I will submit my full testimony for the record. Thank you.
Thank you, Sam, Ro, Alanya. Thank you so much for being here. You are dismissed. Thank you. We appreciate your time. Now we'll hear from Sharon Leslie Brown.
Hello, this is Sharon Leslie Brown from Rose of Sharon Enterprises. Before I start, remember Israel, release the hostages, let Yahweh's people go, defend Israel. Okay, already the ACS has stopped homosexual couples from foster care, and I believe this is a good decision. I believe that they should end the funding of LGBTQIA, any different kind of services that they would have them. They have to have regular services like every other individual. Many LGBTQIA have been sexually abused and were not born that way. And in good faith, I can't, and in good conscience, I can't and we can't support homosexual legislation and bills and whatever in that vein. There is no transphobia. We are not afraid of the LGBTQIA community. We are letting them know this is not transphobia. We are not afraid of you. The Bible says a man shall not lie with a man as with womankind. We have a basis for our belief. It is not anti-LGBTQIA in the classic sense. It is biblically based. No pro-LGBTQIA bill should be passed, once again. We are a Jewish Christian nation, Judeo-Christian as we're commonly called, or Christian, it's all the same. Jewish Christian, Judeo-Christian, Christian. And it's immoral and not moral, it's amoral for homosexuality. But again, we are not afraid and we're not trying to be hateful. We're saying in our belief, this is what God has said in the Bible. This is why we are telling you no. We are not coming up to you and bothering you and harming you. We are speaking to you in free speech and telling you what the Bible says. So we're not trying to harm you and offend you. We're trying to tell you the truth. We must enshrine in law there's only two sexes and there is only two genders. We have male and female, woman and man. Marriage has to also be enshrined in law, and whatever we can do that is between a man and a woman. No fictitious law is going to change that. That's what it is in the Bible. That's what it always will be. They will be against society if they do it. It doesn't matter if they try to become the majority and democratically do it. The Bible still stands.
Thank you so much. All right,
You're
you're
welcome.
dismissed.
Okay.
Thank you.
My name.
So, Raul, I didn't call your name yet. How are you? So we're going to use decorum and respect, like always. It's me and you. It's me and you, okay? Raul, go ahead. You can start. Yes, I will. You could start.
Yes. Oh, I forgot. I'm a rookie. My name is Raul Rivera. I'm the son of Juanita Figueroa. I want to congratulate the 30-plus women in this city council for letting real men off the hook. The women in this city council do not represent women. This oppressive city council is attacking real women, and the fact that the word mother was removed from the language in the city council is a disgrace to Shirley Chisholm, Rosa Parks, and all mothers, and all real mothers. Rosa Parks was a real woman, a real freedom fighter, a civil rights leader. Our civil rights leaders are rolling over in their graves to think this oppressive majority women city council is not protecting real women. Speaker Adams will never come close to any of our civil rights leaders, let alone Rosa Parks, as much as she may try. And this is not a personal attack. This is our freedom of speech, you know? And we say what we say with love. People might not understand that. And for the record, your colleague and chair to the Transportation Committee, Brooks Powers, is blocking people of color from receiving justice. You know, we've been trying to get meetings with her, and she's been blocking us. She's coming up with nonsense. She's met with us in the past. I wouldn't even be here if she gave us our meeting. We have to come to other meetings and be vocal about this. It's pretty shameful. And she's a person of color. As a native New Yorker, I personally invite Musk and the Doge team to investigate every single NGO in this city. Finally, thank you to President Trump, who declared there are only two genders. Long live the real mother. Thank you.
Thank you, Raul. Kate Tiskus. And if there's anyone else in the chamber that didn't get an opportunity to testify that would like to do so, please take the time to do that now. Whenever you're ready, Kate.
Chair Lewis, thank you very much for the opportunity to speak. My name is Kate Tiskus. I work closely with folks who receive funding under Trans Equity as a community organizer and as a registered lobbyist. And I wanted to talk a little bit about what the last month or so of my life has been like, because I'm sure that, you know, it's been wild for you all, but it's been wild for me as well. And the speed at which the TGNC community was successfully targeted, even here in New York, is stunning. We have organizations that have to look for clandestine places to do intake because folks are so afraid to come out to formerly known community places because they're worried about ICE. We have parents who are worried about registering their children as having questions about gender or as trans because they're afraid that that will compromise their children's rights. We have organizations that have received weird emails and direct threats from Doge. Like, everyone is flat out, it's here, it's now, it's in New York. And that's so stunning because New York is a special place that has really done its best to protect everyone, especially queer people. And one thing that I really want to support is all of the bills that are put forward today. They're specific, they're actionable, but the reason I wanted to talk a little bit about what the last month has been like was to remind you of the component of community organizations, because things are changing quickly, and they're the folks who have close ties to people in the community who need to access services as events develop, as laws change, as conditions worsen. They'll be able to adapt quickly, and so I really want to emphasize the $10 million ask for trans equity, prioritizing trans-led organizations, because they're the ones who will be able to be nimble enough to meet the rapidly escalating disaster facing TGNC New Yorkers today. Thank you for your time.
Thank you so much. Audacia and Julia Dennis and Audacia Ray. You may begin.
Afternoon. My name is Audacia Ray. I use they, them pronouns, and I'm the interim executive director of the New York City Anti-Violence Project. And I'm here to express support for all the bills that have been introduced, 1200, 1201, 1203, 1204, as well as the resolutions, and to emphasize that the Trans Equity Fund should get at least 10 million and especially support trans-led orgs. But I also wanted to share that AVP, as an organization that serves LGBTQ survivors of violence, has been seeing a really major uptick in demand from our community for services and support for BIPOC, trans, and non-binary people, as well as immigrant survivors. And so that's becoming an increasing need that we're seeing. And so I want to pass it on to you all. And also to say that this room is full of very brilliant queer and trans people who are leaders on these issues and who are already doing the work. So to any extent that the city can keep funneling money towards trans-led groups, that's really what we want to see. The solutions exist. We have them. And I really would like to encourage that the council keep being in dialogue with this community about what the solutions are and how to support them. In the past, AVP has been critical of bills that require creation of education mechanisms and planning and written agendas, and that's because we know what we need. The Sylvia and Marcia plan that has been out for a couple of years that a lot of folks in this room collaborated on is a stunning example of that. There's also a resource that I can share that AVP and the Center for Urban Pedagogy designed a couple of years ago. We have hard copies of it here, and actually Andy Bowen, who's now with the city, helped design this. This is an info sheet about how folks can access services from the city itself and what folks need to do to figure out who the liaison is and make that happen for themselves.
Thank you so much.
Sure thing.
All right, Julia?
Here? Okay. Sorry. So thank you for this hearing today and for all of the people here, the individuals and experts who've spoken so eloquently about this really important issue, or all of these really important issues. I'm not an expert at all, and I am a cisgender woman, and both of my children are cisgender. I am a mother, and I think lots of people can be. So I don't want to take up any time. I just wanted, because it's not my voice to say, but I want to add my voice in support as a New Yorker and thank people for not preemptively complying like the New York hospitals did. I was shocked. I was disappointed. I believe that it's our job to support everyone. And I think a lot about Fannie Lou Hamer saying nobody's free until everybody's free. And I really think that as New Yorkers, it's sad that we're one of the few places in this country that people identify as a safe place. And I think we need to be in that fight. And I thank you for having this hearing again. And especially my current and previous council members from 35 and 36. And I thank everyone who has the power and the knowledge and the expertise for being in this fight, and I'm here to support you. And I wanted to just add that I don't need to lead, but I'm here to be in it with everyone.
Being here is part of your leadership. We appreciate you. Thank you both for being here. We appreciate you. This panel is dismissed. We're now going to transition to online public testimony.
Because I have to leave, I just wanted to thank everybody for joining us this afternoon, for your testimony, and I just wanted to put out there that today's hearing was not a debate about whether trans people exist. Trans people exist in our city, and the discussion today was what we can do to make our city more inclusive and safer for trans people. So I hope no one walks away from this hearing feeling that there were other intentions. Trans people exist, and we want to make sure that our community, and when trans people are safe, our entire community is safe. And with that, I look forward to reviewing all of the testimonies that are going to be submitted so that we can put in the appropriate amendments. And with that, thank you so much.
Thank you, council member.
On Zoom, Amelia Prochaska, you'll be unmuted.
You may begin.
Good afternoon. My name is Amelia Prohaska. I use she and her pronouns. I'm a training and facilitation specialist with Right to Be, formerly Hollaback. I want to thank you for the opportunity to testify all the important legislation in this urgent issue. Representing both my community as a New Yorker and my organization's work, we were founded in Brooklyn in 2005, and we address all forms of hate and harassment, including the hate and harassment in the trans community. Our work focuses on turning the care that we have for each other into simple, creative, and effective action. We train hundreds of people every day. And today we would like to offer our support of the transgender, nonconforming, and non-binary community as they face increased hate and discrimination. We have 3 supports available for the community specifically. We're currently providing free and virtual bystander intervention training to address anti-LGBTQIA plus hate at an increased pace, with over 10 free sessions available for all New Yorkers for free online, scheduled up until the end of April. We know that reporting hate to the police may not always be safe for trans folks, especially Black trans women, and through our Hate and Hope tracker on our website, it's a secure, anonymous story sharing platform. We've collected stories of harassment from individuals since 2005. We have 32,000 plus stories, and it provides room for solidarity. We also have a unified network of mission-aligned peer organizations, our Ally Solidarity Network, and we're always happy to refer community members. We trust that our city will lead the response nationwide to the current attacks on trans rights. Specifically, I say the name of Sam Nordquist, a New Yorker who was brutally murdered and for whom we show up and do this work. Please do not hesitate to reach out to us, any of you, all city council members and all citizens who are here today. Thank you for the opportunity to testify, for your commitment to making New York City a great place for all New Yorkers and a place where we all have the right to be.
Thank you so much.
Natalia Fiorenzo.
You may begin.
Hi, can you hear me?
Yes, we can hear you. You can begin.
Okay, great. Good afternoon. My name is Natalie Fiorenzo. I use she, her pronouns, and I am a senior corrections specialist at New York County Defender Services in Manhattan, as well as a member of the TGNC NBI task force created by the City Council. I'm grateful for this committee that you recognize the need for this hearing today and the legislation that's been proposed, and that the fact that you've moved so quickly, it's only February 28th, to shore up protections for our city's most vulnerable citizens. The widespread hate and aggression towards transgender, gender nonconforming, non-binary, and intersex individuals affects those on Rikers Island tenfold. As we know, the Department of Correction is embroiled in numerous lawsuits and monitorships outlining their inability to keep those in their custody safe. I have shared in front of this council before that 100% of the transgender women that I have personally worked with who are placed in a male facility are sexually assaulted, physically assaulted, or verbally assaulted, and most typically they experience a brutal combination of all 3. In line with this committee's clear dedication to the safety and personhood of transgender, non-binary, and queer identifying individuals, as the federal government escalates its attacks on this community, I urge you all to sign on to and open the floor to Intro 625. Intro 625 is a powerfully, thoughtfully drafted bill that would ensure that transgender, gender nonconforming, non-binary, and intersex people are housed as safely as possible while in the custody of the Department of Correction. DOC's own reporting shows that they deny over 50% of gender-aligned housing requests. President Trump's recent executive order strips transgender people in federal prisons of their dignity and safety, forcing transgender women to be transferred into men's facilities where they're at a heightened risk of violence and abuse. This cruel directive sends a chilling message nationwide that trans people are unworthy of protection and that their very existence is something to be punished. We as New Yorkers must reject this precedent.
Thank you. Your time's expired.
That in our city, every person deserves to be treated
Thank you
with
so
dignity.
much. You could submit the rest on public testimony. Thank you.
George Danya.
You may begin.
Hello, can you hear me?
Yep.
Yes, you could begin.
Hello, my name is Dr. George Danius. I use they, them pronouns, and I'm a resident physician in psychiatry working in the New York City public hospital system. I'm also a proud member and delegate for CIR, the resident union. Thank you to the Committee of Women and Gender Equity and Council Member Lewis. I'm here testifying in support of the resolutions meant to protect gender-affirming care for New York City's patients. I came to this city for my residency program for many reasons, but one of them was because New York is known as a beacon of gender affirming care, and I wanted to work somewhere that made this essential care available to my patients. So when Trump was elected and a close friend who is trans told me he was considering leaving the country, I told him that we were in New York City. I thought we should be fine here because this city is a haven for queer and trans people. But NYU's recent decision to halt gender-affirming care for youth defied what I thought I knew about my city. Right now, it feels like my friend was right. So it is very personal to me when I implore the City Council to pass these resolutions protecting gender-affirming care and helping to ensure that New York can continue to be the city we thought it was. Study after study show that gender-affirming care not only improves the well-being of trans youth, but saves lives. We know that trans youth who are able to receive this treatment have decreased depression, anxiety, and lower odds of suicidality. This is a core part of the standard of care. I just came out of a stint of working in an inpatient psychiatric unit where a lot of my patients were trans. When I'm with my patients, I'm providing the best care possible. Aspects of my work almost feel disingenuous when I know they might not be able to continue to have access to the treatments they rely on. What I want as a physician is to be part of a system that could help my patients in all the ways they need. We're already working inside of a profit-driven medical system in the US. The last thing that hospital workers want or their patients need is to navigate
Thank you.
yet
Time's
another
expired.
barrier to effective holistic care.
Thank you so much.
Erica Nunez Cespedes.
You may begin.
Thank you to the committee for hosting this hearing today. My name is Erica Nunez Cespedes. My pronouns are she, her, and I'm the Director of UX and Design at PPGNY, Planned Parenthood of Greater New York, and serve on our cross-departmental LGBTQ+ work group. The federal administration's recent anti-trans orders also directly impact my own family and community, and I'm painfully aware that these actions are the first in a long-term plan to pull back on care access and rights for queer people and marginalized communities. PPGNY is a trusted provider of sexual and reproductive health care and education programs, and we proudly provide gender-affirming healthcare at our health centers in New York City. In 2024, we conducted over 1,600 patient visits for gender-affirming hormone therapy, GAT care, and provided care to over 4,800 TGNC individuals. 2025 has brought an increased demand for GAT care, and this includes people who have relocated to New York State to access that care. We recognize that for the TGNC community, access to resources has historically been out of reach, steeped in stigma and discrimination. Trans people have been forced to live on the margins with limited access to compassionate, affordable, and comprehensive health care. Recent attacks on gender-affirming care nationwide have forced many in the community to go without care, and it is imperative New York remains a beacon for TGNC people seeking care and that our healthcare facilities comply with city and state laws, which protect access to gender-affirming care and require non-discriminatory access to care, regardless of the federal political winds. PPGNY supports measures by the New York City Council that help ensure that TGNC communities can attain the resources they depend on. While we support Intro 3093, which would safeguard access to facilities providing SRH and gender-affirming care, we caution against creating criminal provisions within this law because of potential unintended consequences. We recognize the importance of safeguarding access to SRH care as anti-abortion and anti-GAT care protesters become more emboldened under the Trump-Vance administration. However, in
Your time's expired.
Thank you. You could submit the rest of your testimony at council.nyc.gov. Thank you.
Andy Eisenson.
You may begin.
Andy?
Hi, thank you so much. Thank you for unmuting me. Good afternoon, Chair Lewis and members of the committee, and thank you for having me in to testify, and thank you to the council members, Kaban, Hanif, Asay, Butcher, Hudson, and Schulman. I'm the Senior Legal Director at the Chosen Family Law Center. I work with LGBTQ plus clients all over New York State. I'm also a law professor at the LGBTQ plus advocacy clinic at Harvard Law School. And in that position, I've spent the last year researching shield, sanctuary, and other protective laws that at the state and municipal level that are being passed all over the country. And I want to say I've never seen a package as comprehensive and likely to be effective as the package on the table today. I'm also on the board of directors for the Accountability Journalism Institute, and so I can say we are in an environment of violent propaganda and disinformation meant to tear our communities apart and prevent us from connecting with each other, coming together, and rising up. The clients that we work with who are trans are not only trans. Equity for trans people means immigrant justice, reproductive justice, economic justice, and every other destruction of violent oppression on every level. The anti-trans legislation that's being passed across the country at the state and federal level is being written and promulgated by the Heritage Foundation, and they understand the eradication of trans people to be inextricable from the restriction of reproductive freedom and the genocidal anti-immigrant measures that they're passing. So expressing that New York cares about New Yorkers, no matter how long-standing or new, no matter what their New York residency means to them, is what this package of bills is for. A previous speaker said this is not homophobia. We are not afraid, and I don't think that's true. I think what we're seeing is the last gasp of a dying mindset of hate trying desperately to keep itself alive in a New York City that is not a place where it can take root. So I want to urge the council to pass
Time's
a
expired.
package of measures. I greatly appreciate your time. Thank you so much.
Thank you. I want to thank everybody for coming out today, and I want to thank everyone who testified both in person and via Zoom. We appreciate you, your advocacy, and we see you. And with that said, seeing that no one else is here to testify, if you do want to provide testimony, please submit it at testimony@council.nyc.gov. Have a blessed weekend. This hearing is now adjourned.